Good morning to everyone. May we remind our participants to kindly settle down on your seats as we will begin in 2 minutes. Thank you. Punta na tayo dito. Let's start na daw.
Sabi natin kay Sir Paul, hindi makikita lahat. Hindi talaga makikita.
Pag
Kaya
sa
kami
gilid.
nagigilid yung
Sir Paul. Sir, yung podium. Tara. Sir.
May list na daw po kayo ng introduction.
Ah,
Ito po ba yan?
alin ma'am? Ito ba? Acknowledgement? Or
Okay na pa tanong.
A pleasant morning to our esteemed guests and welcome to the first regional conference on maternal and child health in Calabarzon in partnership with the 14th International Conference on the MCH Handbook. My name is Arlene Borbe from Health Education and Promotion Unit.
And I am Patrick Aurepepa from the Human Resource Development section, and we will be your MCs for this conference. This event is organized by the Department of Health Center for Health Development Calabarzon in collaboration with the International Committee of the MCH Handbook and the University of the Philippines, Manila.
A very warm welcome to everyone gathered here today. Please rise and let's bow our head for the interfaith prayer.
In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Our most gracious Heavenly Father, we come to you today to praise and worship you and give you thanks for all the things you continue to provide for ourselves and our families. Father, we humbly ask for forgiveness for all the times you have offended you. Continue to guide and protect us, Lord. Bestow upon us your unending grace and healing, that we may in turn become instruments of gentleness and compassion to others. We ask all this in the name of your Son, our Lord Jesus Christ, with prayer and intercession of our Blessed Mother. Amen.
بسم الله الرحمن الرحيم اللهم إياك نعبد وإياك نستعين اللهم اهدنا الصراط المستقيم اللهم وحد صفوفنا بين المسلمين والنصارى واللوماد إلى صراطك المستقيم اللهم امنحهم العيش بالأمن والسلامة والتنمية المستدامة في مدينة دافاو اللهم لا تزغ قلوبنا بعد إذ هديتنا وهب لنا من لدنك رحمة إنك أنت الوهاب ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار والحمد لله رب العالمين.
Amoy nen manama kami gimot tolangon. Manotod kakaroson no. Si koikaw kami dokul tolangon. Way migtumpi to tano. Si koikaw kami bohoy to kopianan tolangon na maotaw. Pusako kapusong no. Kana akong to pabulos koy. O agbuyo koikaw way bohoy kat pabor. Kahalaan kalinaw to kanami. No pag-ugpo. Way kasabo ka koy oyot kalambo. Kay kuro tamana kakodin panubad way pag-ampo, kaupianan igboy no, way kakoy ko ni mo no, way kalaan ka lang mo.
Please remain standing for the Philippine National Anthem, to be followed by DOH hymn, to be led by Ms. Danica Estepolar, Health Program Researcher from DOH CHT Calabarzon.
Palas na silanganan, alab na puso, sa dibdib mo'y buhay. Napanghihiran, duyang ka ng magiting, sa manlulupig, di ka pasisiin, sa dagat at putok, sa sipoy at sa langit ng bukaw, may lagang tulad na bisa, paglayang inahangahan, ang kislap ng pagkabat, may tagumpay na napilihan, ang bituin at araw niya, kailan pa may di magdidilim, lupa ng harap, ng pagputik magsalap, kahit sa piling mo, ang iligaya na pag may mag-aapit, ang mabatay ng dahil sa'yo. tungkuling sinumpaan. Laan sa'yo ang aking ang buhay upang tayo'y magtagumpay sa pagbuo ng isang bansa na matatag at malaya.
Ladies and gentlemen, please take your respective seats. And thank you, Ms. Danica Estipular, for leading our Philippine National Anthem and the Department of Health hymn. At this point, we would like to acknowledge the presence of our distinguished guests and partners. First, we have Dr. Glenn Matthew G. Bagao, Undersecretary of Health, Department of Health, Philippines.
And we also have international delegates. We have Dr. Yoshihide Nakamura from Japan, International Committee on MCH Handbook. Good morning, sir.
We also have representatives from provincial health offices and the local government units. We have Honorable Leo Vigildo K. Morfe, Mayor of Rosario, Batangas.
We also have Honorable Maria Meriden Isaac, Mayor of Giniangan, Quezon.
Good morning, ma'am. We also have Honorable Ruben Uy Diokno, Mayor of Padre Burgos, Quezon.
We have also Honorable Cherise Marie Escalona, Mayor of Perez, Quezon.
We are also joined this morning by Honorable Cristeta Reyes, Mayor of Malbar, Batangas. Good morning, ma'am.
We have also Honorable Ronald Cosico, Mayor of Paite, Laguna. Good morning, sir.
Honorable Catherine Robles, Vice Mayor of Baras, Rizal.
We also have Councilor Reynaldo Palabrica from Bacoor, Cavite.
Hi,
Good
sir.
morning, sir.
Yeah. He's the Councilor of Bacoor City, Cavite. We also have Attorney Christine Jane Barison, Councilor of Kawit, Cavite. We also have the members or Calabarzon officers from the Association of Municipal Health Officers, or AMHOP.
We have also municipal or city health officers.
And we also have here this morning the DOH CHD4A Management Committee. We have Dr. Leda M. Hernandez, Assistant Regional Director.
We have also Ms. Rosel Carrion, Chief Administrative Officer of MSD.
May we also acknowledge Dr. Maria Elena G. Castillo Gonzalez, Chief of the Local Health Support Division.
Of course, we have Dr. Monica Jennifer Victorino, Licensing Officer 5 of Regulations, Licensing Enforcement Division.
We also have representatives from various provincial Department of Health offices. May we have or can we have our DMOs? Yan. So please rise po so that we can acknowledge you.
Also have, sir, we have Vice Governor Reynaldo San Juan Jr. from Rizal. Good morning, sir.
Good morning, sir. Thank you for joining us. And we also have representatives from DOH retained hospitals. We have Dr. Ramoncito Magnaye, Medical Center Chief 2 of Batangas Medical Center.
We also have Dr. Ruby Ephraim Rubiano, Medical Center Chief of Southern Tagalog Regional Hospital.
And from Maria L. Eliasar General Hospital, we have Dr. Malcolm Remo, Medical Center Chief 1.
We also have Referral Hospital of Calabarzon. We have here Edgar M. Palacol, Chief of Hospital or Medical Specialist 3 of LPH.
And we would also like to acknowledge our partners from the University of the Philippines, Manila, starting off with Dr. Michael L.T., Chancellor of the University of the Philippines, Manila. Good morning, sir. We also have the director of the Institute of Reproductive Health, University of the Philippines, Manila, National Institute of Health, Dr. Mario Philip Pestin.
Also from UP Manila, we have Dr. Maria Constancia Carrillo, Dean of College of Arts and Sciences, UP Manila.
And Professor or Dr. Calvin De Los Reyes, faculty member, College of Arts and Sciences, University of the Philippines, Manila. SMP partners. We would also like to acknowledge the partners of the Safe Motherhood program who are joining us for this activity or for this conference. First, we have the Philippine Obstetric and Gynecological Society. And the Philippine Pediatric Society.
We also have Integrated Midwives Association of the Philippines.
Morning po.
Family Planning Organization of the Philippines is also here.
We are also joined by representatives from PhilHealth, National Capital Region, and PhilHealth, Calabarzon.
We also have Save the Children and also our media partner ABS-CBN is here.
Yeah. So thank you very much for joining us.
We have also as supporting partners, of course, we have Japan International Cooperation Agency,
Friends of WHO Japan,
we have also HANDS Health and Development Service,
Canison Company Limited,
COA Company Limited,
and Himawara no Kai.
Himawari no Kai.
Yeah. And we would also like to acknowledge our representatives from PHS. Yeah. Okay.
significantly contributed to our collective mission of ensuring healthier futures for mothers and children globally. Ms. Marloes Welliner, project lead of the Netherlands MCH Handbook at the Amsterdam Public Health Service, who is joining us virtually, exemplifies dedication to improving maternal and child health outcomes in the region through her leadership in handbook development and implementation. The representative of our Secretary of Health, Dr. Chidoro Tederbosa, none other than our USEC Glenn Matthew Bagao, a visionary leader whose unwavering commitment that will put forward our 8-point action agenda of our secretary. We are emboldened to chart a course toward a future where our influence transcends boundaries, nurturing a healthier and more prosperous society for all. Today, we embark on a journey of shared commitment and unwavering dedication towards the noble cause of maternal and child health. As we convene for this landmark conference, let us pause to acknowledge the profound significance of our collective mission to ensure safer beginnings and healthier futures for mothers and children across Calabarzon region and beyond. Our objectives are very clear. Our goals resolute to decrease maternal and neonatal mortality rates, to empower expectant mothers with knowledge and resources, and to foster a culture of proactive healthcare delivery. Through effective implementation of the universal health care and the 8-point action agenda, coupled with the utilization of the maternal and child health handbooks, we strive to provide comprehensive guidance and support at every stage of the maternal and child health journey. In the spirit of collaboration and innovation, we have assembled a distinguished panel of experts and stakeholders from around the globe. Together, we will explore transformative strategies, integrate personalized care plans, and enhance vigilance through timely information dissemination. Our aim is not only to strengthen referral system, but also promote global collaboration, facilitate practical learning, and empower communities to take charge of their health and well-being. As we embark on this journey, let us inspired by the words of our conference tagline, ensuring universal health care and the 8-point action agenda through effective maternal and child health services and the maternal and child health handbook. Let us heed the call to action, reaffirm our commitment to the fundamental right of every mother and child to access quality healthcare services. Together, let us make the conference a beacon of hope, a catalyst for change, and a testament for our shared resolve to create a world where every birth is a safe beginning and every child can thrive. Thank you.
Thank you very much, Dr. Leda M. Hernandez, Assistant Regional Director, Director 3 of the Center for Health Development Calabarzon, for your wonderful welcome message.
So to discuss the objectives of this conference, may we have Dr. Mark Nicolas O. Santos, Medical Officer.
Again, my name is Mark Nicolas O. Santos, or you can call me Doc Nick, the current Family Health Cluster Head of the Department of Health, Center for Health Development, Calabarzon, or Region 4A. So I am tasked to present the objective settings and program presentation. So this activity aims to address the goal of decreasing maternal and neonatal deaths in the region by incorporating the universal health care and 8-point action agenda through effective maternal and child health care and through the use of maternal and child handbook. This focuses on the provision of comprehensive guidance on prenatal care, where we empower expectant mothers with knowledge that fosters a healthier pregnancy and advocate. postnatal care, where we encourage mothers to seek medical attention for themselves and for their infants as well. This will serve as a platform for sharing knowledge, promoting collaboration, and advancing uh, policies and practices in the areas of maternal and child health to decrease maternal and neonatal mortality. So as we all know, and for those who does not know, for our guests, international guests, we have the Department of Health Strategic Focus, where we aim to guarantee access to quality primary care services. So there are 8 priority outcomes, one of which is maternal health, where the department aims to decrease maternal deaths to less than 111 per 100,000 live births from 154 from 100 per 100,000 live births. So out of the 8 priority programs, 8 priority outcomes of the Department of Health, one is maternal health. The objectives of this program is, of this activity or conference, seeks to create a dynamic platform for knowledge exchanges, collaborations, and actionable insights, ultimately contributing to a global movement for safer and healthier beginnings for mother and children worldwide. There are 9 objectives for this conference. First is to explore the transformative power of health booklets. So it is amazing that as little as the health, maternal and child health booklet can help our mothers and infants through their journey in pregnancy. We would like to examine how health booklets can serve as catalysts for positive health behaviors and outcomes among mothers and infants. Next is to integrate birth plans into health booklets. We want to discuss strategies for seamlessly incorporate personalized birth plans into the maternal and child health booklets, fostering a proactive and individualized approach to maternal care. Next is to enhance vigilance through information dissemination. We would like to investigate methods to disseminate information within the health booklets so we can raise awareness about the danger signs during pregnancy, enabling early identification and timely intervention. Next sets of objectives are to strengthen referral systems using the health booklets. We would like to explore the role of health booklets in streamlining and improving referral systems, ensuring a swift response to complications during pregnancy and childbirth. Next is to promote global collaboration. So as evident, we have our international partners here in this conference. We would like to foster international collaboration among healthcare professionals, policymakers, and advocates as well, so that we can share insights, best practices, and innovations related to health booklets and comprehensive maternal and child health strategies. We would also like to facilitate practical learning. We will be conducting workshops and interactive sessions as well to guide participants in designing effective health booklets, implementing the birth plans, and recognizing danger signs. Next is to showcase successful implementations. We would like to highlight and celebrate successful case studies where health booklets have contributed significantly to reducing maternal and neonatal deaths for local and international. Next is to explore technological innovation. So later on in the program, there's a part where our partners will be presenting their technological innovations to the body. So we'd like to examine technological advancements that enhance the accessibility, reach, and effectiveness of health booklets in diverse healthcare settings. And last but not the least is to empower communities. We'd like to discuss approaches to empower communities through the utilization of health booklets, emphasizing the collaborative effort needed to achieve safer pregnancies and childbirth. So for the program proper, so this will be a 2-day conference. For the first day, Dr. Aleda Hernandez, our Assistant Regional Director, already delivered her welcoming remarks. And yours truly is already presenting the objective setting and program presentation. So there will be a minor change for the program. One of our keynote or our first keynote speaker, Undersecretary Glenn Matthew Bagao, will be delivering his keynote speech after this presentation of objective and program presentation. Afterwards, there will be various messages of support from various partners and of course from the Department of Health. So I will not be reading each of the guest speakers as they will be introduced properly as the program goes on. So we will be having our messages of support from 9:45 to 10:55 a.m. Afterwards, we will be having our second keynote speaker, Professor Yasuhide Nakamura. Then we will be having our lunch break for the first day and photo opportunity as well. Then for the afternoon session, we will be having two afternoon sessions, global experiences on maternal child health and the MCH Handbook. So we will be having various speakers from different countries. No? So again, I will not be reading each of the speakers as they will be introduced properly as the program goes on. They will be given 15 minutes each for per presentation. Then for the last part of the first day, we will be continuing the global experiences on MCH and MCH handbooks. We will be having again our international partners as guest speakers. I think the international speakers will be having some will be having online videos, some will be having recorded videos, and some will be presenting during this conference. For the second and last day, we will be having our recap for the first day headed by Dr. Atsumi Noda, our Regional Safe Motherhood Program Medical Coordinator. Then for the first session, for the second day, we will be having various speakers and guests where we will be discussing the topic addressing maternal and child mortality. So again, all speakers will be introduced during the program. During the afternoon session, we will be having our second topic, which is towards effective maternal child care. So again, we will be having various speakers, local and international. Then for the last part of the second day, there will be messages of support from our provincial governors. And we will be having our pledge of commitment to be headed by Dr. Ramoncito Magnaye. Then call to action and announcement of the next conference to be headed by the International Committee on MCH Handbook. And to formally close the program, yours truly will be giving the closing remarks. So again, we would like to thank everyone for attending this activity. I hope we can pick up some good practices and let's enjoy this moment and give time to learn new practices. So thank you, everyone.
Thank you very much, Dr. Mark Nicolas O. Santos, Medical Officer 4 of the Family Health Cluster, Center for Health Development, Calabarzon, for discussing the objectives and the flow of the program for this conference. At this point, we would like to acknowledge the presence of our provincial health team leaders from the different provincial DOH offices. From Rizal, we have Dr. Voltaire Guadalupe.
Of course, from Batangas, we have Dr. Elizabeth Sorio.
Pidoho Cavite is represented by Dr. Armida Campos Sagrado. And we also have representatives from Pidoho, Laguna, and Quezon. At this point of the program, we will proceed with the messages of support. And it is my honor to share the message from Her Imperial Highness, Crown Princess Akishino of Japan. Her Imperial Highness, Crown Princess Akishino of Japan, President of the Imperial Gift Foundation, Bushi Ai Kokai, is watching the first regional conference on maternal and child health in Calabarzon, which is held in partnership with the 14th International Conference on the MCH Handbook online. Her Imperial Highness Crown Princess expresses her respect to all the participants who have been working hard with the MCH handbooks and wishes the success of this conference.
For another message of support to represent Dr. Anna Marie Salina Garfin, Director 4 of Disease Prevention and Control Bureau, let us all welcome Dr. Ann Isabel Gonzalez Andres, Medical Officer 4 from Disease Prevention and Control Bureau, Department of Health, Philippines, to give a message of support. Good morning, Doc.
Good morning po. So, on behalf po of Director Celine Garfin, I am Dr. Wise Andres, the program Focal of Safe Motherhood in the Department of Health, Disease Prevention and Control Bureau. So, firstly po, happy Safe Motherhood Week to all of us. So, every May is we celebrate the Safe Motherhood Week, also the Mother's Day, diba? So, kindly greet the person next to you, lalo na kung sila po ay nanay, ng Happy Mother's Day and Happy Safe Motherhood Week. Ayan. So, salamat po. Ayan. Thank you po. So, the past decade was determined by the limited progress in reducing maternal mortality and slow decline of childhood mortality in our country. The Department of Health recognizes the importance of maternal and child health initiatives. Maternal health is one of the priority programs of the Secretary. This means our goal is to reduce maternal mortality ratio to less than 111 by 2028 and achieve the SDG 3.1 MMR of 70 per 100,000 live births by 2030. We recognize the large burden of maternal and neonatal health improvement heavily lies in the development of the capacity of individuals, communities, and societies, and investing in mothers and children through healthcare and nutrition, which ultimately contributes to the realization of specific goals and targets to reduce maternal and childhood mortality. In retrospect, there is common misconception that in order for us to improve our maternal and child health, it requires expensive technologies and sophisticated innovations. But in reality, most conditions can be prevented or treated without sophisticated and expensive technology. Through strengthening of the maternal health service delivery, specifically putting an importance on the quality antenatal and postnatal care, and assistance of skilled health professionals in facility-based deliveries, we improve the overall maternal health outcomes of the Filipino mothers. With that in mind, the department wishes that we can all work together to provide high-quality care to our women and children. We have the knowledge to change our thinking and ways. Now we challenge ourselves to translate these into actions and reach those women and children who are most in need. So patuloy po tayong magtatrabaho upang makapagbigay ng ligtas, dekalidad at mapagkalingang serbisyo. We look forward to the success of the first regional conference on maternal and child health care and the continued progress in the Safe Motherhood program in our country. Through these, we are a step closer to universal health care dahil sa bagong Pilipinas, bawat buntis ay mahalaga. Maraming salamat po.
Thank you very much, Dr. Ann Isabel Gonzalez Andres, Medical Officer 4 from the Disease Prevention and Control Bureau of the Department of Health, Philippines, for your message of support. On her behalf, the message of Mrs. Seiko Noda, former Minister of Internal Affairs, House of Representatives, Government of Japan, and President of Himawari Nokai, will be read by Professor Noriko Komatsu of Soka University.
Good morning. I am reading message from Seiko Noda. Hello everyone. My name is Seiko Noda. a member of the House of Representatives of Japan, and I am the chairperson of the NPO Himawari, an organization that supports pregnant or child-rearing mothers. The NPO Himawari has been supporting pregnant or child-rearing mothers for 23 years. In recent years, we have been operating a mobile phone appli for the MCH Handbook. We are trying to enhance our support for pregnant or child-rearing mothers by utilizing the support of major Japanese companies. Next. In addition, this year, we have taken on the responsibility of managing the website of the International Conference on MCH Handbook. Together with you, we will continue to support expectant and nursing mothers around the world. In 1948, the world's first MCH handbook was created in Japan. Subsequently, the Maternal and Child Health Act was enacted, and the environment for protecting the health of mothers and children was improved, resulting in the current infant mortality rate and maternal mortality ratio being among the lowest in the world. Next. However, we recognize that there are still many challenges. Japan is experiencing one of the world's most serious decline in fertility. We must promote the development of an environment in which mothers and families can have and raise children with peace of mind. In addition, care for social minority is also inadequate. For example, there are many children in Japan who have roots in the Philippines. We need to constantly look at whether the environment surrounding these children is better. We will promote policy and support activities so that the environment for childbirth and childcare will be in line with the key phrase, "No one is left behind." Next. As a politician, I have worked hard to establish the law for supporting children with medical care and to establish the Child and Family Agency in 2023. On a personal note, my 13-year-old son has a disability. I am continuing my political activities while I have dealt with his upbringing with all my heart and soul. I understand firsthand the concerns and challenges of mothers and their families, and the importance of supporting childbirth and childcare throughout society. Today, I am very happy and grateful to have the opportunity to participate in the activity of people who share the same concern. The NPO Himawari will continue to do its utmost to support pregnant and nursing mothers. Thank you very much. Maraming salamat po.
Thank you very much, Professor Noriko Komatsu of Soka University, for sharing the message of Mrs. Seiko Noda.
To show us the support, of course, let's hear it from Honorable Reynaldo San Juan Jr., Vice Governor of Rizal.
Thank you. A pleasant day to everyone. It's an honor and privilege for me to be here and be part of this very worthy endeavor of DOH Region 4A, of course, albeit as a representative of Governor Nina Ricci Henares. Today's conference on maternal and child health speaks volumes of our high regard to the importance of taking good care of our mothers and children, especially during the first 1,000 days of a child's life. During pregnancy, the health, nutrition, and stress levels can have an effect on the baby's future. We call the first 1,000 days as the window of opportunity, where it is the opportune time to provide the best care for mothers and children in terms of mental, physical, and emotional support. Ito rin ang mahalagang pagkakataon upang ipagkaloob sa mga ina ang napakahalagang nutrisyon, of course, sa ating mga bata, o ang pagkakaroon ng well-balanced diet para sa kanilang malakas at maayos na kalusugan. Sadly, many women and children have little access to essential quality health services, including nutritional considerations. And this important public health issue is what we are trying to address in this conference on a wider scale and comprehensive approach. At lubos po ang aking paniniwala sa kakayahan ng aking mga kapwa doctors na narito to come up with recommendations and policies to attain our goal of decreasing maternal and neonatal mortality and morbidity. We have the opportunity to solve this problem or lessen its impact and improve the health and well-being of mother and child. Hopefully, in this conference, we would be able to come up with answers or recommendations based on health statistics systems and other informative data that will ensure that every child and mother will have a healthy start in life, and every mother will have access to quality health care during pregnancy and childbirth. It is also fitting that the launching of your MCH Handbook with the theme Safe Beginnings encapsulates what I have just stated because truly, right from the moment a husband and wife plans to build a family through pregnancy up to the delivery of a child and the proper care and safety of a mother and child, that suit starts from the very beginning. And the birth of a new child should always be a time for celebration. Again, in behalf of our Governor, Governor Rina Ricci Henares, and the entire provincial government of Rizal, I wish this conference huge success. Muli po, tanggapin po ninyo ang aming mainit at taus-pusong pagbati. Congratulations, DOH, for again having this very worthy and noble endeavor. Maraming salamat po at mabuhay po tayong lahat.
Thank you very much, Honorable Vice Mayor, Vice
Governor.
Governor, I'm sorry, Honorable Vice Governor Reynaldo San Juan Jr. of Rizal for your support.
To show us again the support, let's hear it from maternal health specialist, maternal child health and quality safety from World Health Organization, Western Pacific Region. Let's give a round of applause to Dr. Sumilia Serrano.
Good morning, everyone. I'm Sumire Solano, a maternal health specialist from the WHO Regional Office for the Western Pacific. I am humbled and deeply honored to extend my heartfelt support to the first regional conference on maternal and child health in Calabarzon, in partnership with the 14th International Conference on MCH Handbook. The MCH Handbook highlights patient-centered care by empowering women and their children to take ownership of their health and healthcare decisions. It has a profound impact on the lives of mothers and children and the way healthcare workers provide care. It is our priority of the WHO to assist frontline healthcare workers to support women and children for safe motherhood and childhood throughout the continuum of care. Through supporting various countries, we have witnessed how MCH Handbook has supported women for positive experiences during pregnancies, delivery, and postpartum period. How the handbook has supported babies and children in receiving essential care, how the handbook has navigated frontline providers in improving appropriate care. I'd like to share one strong evidence that our colleagues have witnessed in Lao PDR. As many of you know well, WHO published recommendation on antenatal care for a positive pregnancy in 2016. Lao Ministry of Health translated respectful care in the recommendation into an antenatal care package. A randomized controlled study has shown a significant increase in return of women to health facilities for delivery. In this study, one of the key factors in translating respectful care into practice was the MCH Handbook. This conference represents a unique opportunity to share knowledge, strategies, and innovations that can transform our approach to healthcare. By coming together, we can build a stronger support system and create sustainable improvement in healthcare quality and health outcome for the family across the region and beyond. I'd like to convey my sincere appreciation to the organizer and the participant of this meeting for the very powerful support to the frontline provider, women and children. WHO Regional Office for the Western Pacific would like to continue our close collaboration for the health and the future of the women and children. Thank you. Maraming salamat po.
Thank you so much.
Thank you very much, Dr. Sumire Sorano, maternal health specialist, maternal child health and quality safety from the World Health
WHO.
Organization Western Pacific region.
Yes.
We will hear the message of support of Dr. Ann Ditjen, child health specialist from the United Nations Children's Fund, or UNICEF, headquarters in New York, through a video recording.
Dear organizers and dear participants of the Regional Conference on Maternal and Child Health and the Maternal and Child Health Handbook Conference. It's a pleasure to provide a few opening remarks as you embark on what looks like interesting and stimulating discussions and the sharing of experiences from across the globe. Over the past years, following the launch of the UN Secretary General's Global Strategy for Women's, Children's and Adolescents' Health, UNICEF and the WHO have collaborated very closely to provide a vision, guidance, learning, and support to countries on how to strengthen systems and services and ensure a life course approach to child health and development. What happens to a child during one phase of his life impacts its trajectory for optimal development moving forward. And there's a need to mitigate the risks to women and children, be it environmentally, socioeconomic, safety, or others, while ensuring universal access to quality health services that are equipped to provide preventive, protective, and curative care, but also supportive services that are well beyond health, including the social, education, and other important sectors. Some of the key areas of work that are also relevant in the context of your conference theme around safe beginnings include early child development and support to caregivers. Guided by the Nurturing Care Framework, launched in 2018, we focus specifically on the role of health and nutrition services to provide better support to caregivers and strengthen their practices to provide responsive care and not only nurture their children to good health and nutrition, but also understand the importance of early learning, a safe and secure home and environment. This means improving the skills of health and other key providers and ensure health facilities, newborn and pediatric wards, etc., are inclusive, child-friendly, and equipped for these efforts. Just a few weeks ago, WHO and UNICEF launched a new guidance on scheduled child and adolescent well care visits. This guidance, aimed at policymakers and managers, service providers, and partners, outlines what is required to strengthen health systems and services for scheduled, routine contacts with providers to support children and adolescents in their growth and developmental trajectory, as well as their primary caregivers and families. It provides the rationale and objectives of well care visits, and proposes a minimum of 17 scheduled visits between birth and age 19. In addition, it describes the expected provider tasks during a contact, age-specific content to be addressed during each contact, and proposes actions to build on and maximize existing opportunities and resources. Home-based records, a topic that you will pay a lot of attention to today, such as maternal and child health handbooks, are an important and useful tool in our overall effort and can be extremely useful as a record to accompany a child through its life course, monitor its trajectory, for example, at times of well-care visits. But we know, and you will spend the next day and a half to dive more deeply into this, that home-based records are too often suboptimally implemented and do not serve either of its main users, service providers, caregivers, and program managers. My colleague Keiko Osaku from JICA will touch on some of these implementation challenges in her upcoming presentation. Over the past years, UNICEF, WHO, and JICA have collaborated closely to strengthen the implementation of home-based records. Last year, we launched a practical guide that addresses key elements of the implementation of home-based records, from planning and situation analysis to content selection and design, and on to implementation and monitoring. You have a very diverse set of countries represented during this conference. We are eager to hear about your challenges and successes in strengthening home-based records. We are also curious to hear your feedback on the implementation guide, if you have read it, or better, have or plan to use it. If you have not heard about it, we encourage you to take a look. I have shared some key reference documents with the organizers that I referred to during my remarks, including a practice guide for nurturing care, the new well visits guidance, as well as links to a recent dissemination webinar and the implementation guide for home-based records. I hope they can be shared with you. With this, I thank you very much for your attention and pass it on to the next speaker, wishing you a successful and stimulating conference.
Thank you very much, Dr. Andy Jin, Child Health Specialist from the United Nations Children's Fund, or UNICEF, headquarters, New York.
So at this point, we will be joined by Ms. Haruko Kamei, Director General of Human Development Department of Japan International Cooperation Agency via Zoom.
We'll wait for a few minutes as we try to reach Ms. Haruko Kamei via Zoom. Thank you.
While we are waiting for Ms. Haruko Kamei, let me acknowledge also the presence of Mayor of Baras Rizal, Honorable Catherine Robles. And also we have Provincial Health Officer Representative and bosses, and also Provincial Health Officer 2 of Laguna, Dr. Rene Bagamasbad.
Thank you very
Good
much
morning
for
po.
joining us in this conference. Let's also take this opportunity to express our sincerest gratitude to our generous partners: Japan International Cooperation Agency, Friends of WHO Japan, Health and Development Service, Canison Company Limited, Kowa Company Limited, and Himawara Nokai.
We also have Dr. Noni John Dalisay. We also have Dr. Laurie Lee Salonga. Dr. Ms. Joanne Reyes is here also. Ms. Hazel Criancha. Ms. Lourdes Coronado is here. Of course, Ma'am Annalisa Brenica. Good morning, ma'am. And we have also Ms. Sherilyn Pajarillo.
Yeah, they are the representatives from different provincial health offices here in
And also we
Calabarzon.
have Ms. Maria Christine Dayapan.
Thank you very much for joining us in this conference.
Good morning, everyone. For organizer to give the opportunity. Also, the handbook means health facilities during JICA training and the implement in all country. About 30 years them. Japanese experience of MCH handbook all over the world. I cannot emphasize the importance of MCH handbook. Today, I have brought my own and my adult MCH book. This one is mine, which is more than a century old, and the other one is my daughter's, which is 12 years old. These are published by the science Kawasaki in Japan. I keep these because these handbooks are very important. Both books have helped us track records of growth and other information, thereby keeping us healthy. The books even enable us to go through the admission process of schools by providing back input and adequate care of women and children at home and in your community. We believe that our strategy and vision with this conference, as this year's conference theme is ensuring universal healthcare, effective MCH services, and MCH handbook. Under this strategy, JICA works with over 8 countries on the MCH handbook project, and about 60 countries participate in the training program in the past fiscal year. We are also exploring the digitalization of the book or tool on the book and to share the lessons among our countries. Through our cooperation, we emphasize the collective impact as collaboration among government, partners, and civil society can lead multiple outcomes than a simple effort. That is why I organize our post conference as a sort of platform for learning and for opportunities for further cooperation. Also, I'm also happy to announce that JICA, in collaboration with the WHO UNICEF, I've already mentioned by the folks from New York, issued an implementation guide home-based records for maternal and child health last year. I am looking forward to participate today. We join the session referring to this guide, efficient, effective interaction and implementation of the home-based record. I'd like to conclude my work by expressing my hope that this conference will provide important opportunities for various countries to share lessons, experiences, and promote the utilization of MCH Handbook for mothers and children. Thank you very much.
Thank you very much, Ms. Haruko Kamei, Director General of the Human Development Department from Japan International Cooperation Agency, or JICA. May we call on Dr. Michael L.T., Chancellor of the University of the Philippines, Manila, for his message of support. Good morning po.
Hello, hello. Good na to, good. Congratulations to our organizers, especially for bringing together regional experts, regional leaders to this conference. And I'd like to thank everyone for sharing the goal for ensuring universal health care through maternal child health and the use of maternal and child health development handbook. Yesterday, I was met or visited by Professor Yasuhide Nakamura. He's waving there, and I was informed that it was in 1947 that the handbook was originally published, and so I had to do a search. You know, as a usual academe, you have to verify everything. So then I came up with the paper in the Journal of Medical Association, Japan Medical Association Journal, published in 2010, authored by Professor Nakamura. And it was there that I learned that it was originally published in, I hope I mentioned this is correct, Boshi Teko. Boshi Teko means maternal and child book. But to improve its traction, there was a very important addition. And it was renamed to Boshi Kenko Teko. And now it stands for Maternal and Child Health. And with that, there was a very significant change in the way it was accepted and now is impacting the lives of our children and mothers. Now, I was told that it was in 1998 that it was launched in the Philippines. And I also told him, it was during the time that I graduated, got married, and started to have someone with the potential to be a mother. That mother is a pediatrician, and so in the year 2000, we started to be excitedly filling out something like this. I was supposed to look for it when I got home yesterday and show to you how important a maternal and child handbook is to parents. It is not just a guide. It is not just something that we use to look at the growth rate of your mother's womb, the centimeter from the pubis, and then the vaccination of my kids, the weight. As my wife is a pediatrician, and so she checks my child, but I'm the one who would plot and will tell her, you're hitting target. My junior will be a good boy. So it adds what I may call a socially relevant information and value. Because now, it becomes a treasure. Now, I want to ask all of you, ilan sa inyo ang may anak, or how many of you have children whose handbook you still keep in there? You see, That is the impact of this booklet. It is something that you will show 18 years after the daughter is born during the debut. When your child gets married during the wedding, you show it that this is the plot of how the child grew up. And that is the impact of a simple book like this. That is why I'm very happy to see all of you here now, because really 2 weeks ago or 10 days ago, I told the university my plans, and one of the plans is what I call agile response. Agile for me stands for academe, government, industry, leadership engagement. And looking at the audience here today, you have the academe in us, the professors. We have here the government represented by our USEC Undersecretary Bagao, along with the regional leaders, our LGU leaders. Thank you for coming here. And then our industry. The industry are the practitioners, the midwives, the obstetricians, and the pediatricians. Thank you, Ma'am. Because all of this will only happen if all of us work together. When the leaders believe in a single goal, and that goal that we are going to do is to improve maternal and child health. This is the first. But I am sure this will be followed by several other regions. And when we talk about regions, it's not just the region of the Philippines, but also the regions in Asia, Asia Pacific, and we even have the World Health Organization backing us. And with that, I pledge the full support of the University of the Philippines through our Department of Pediatrics, our Department of Obstetrics and Gynecology, our National Institutes of Health, which has the Institutes for Child Health and Human Development, and the newly formed Institute of Reproductive Health. These 4 institutions will be your partners to create policies for them. But in addition to that, I will not forget the value of humanity and behavioral sciences. That's why we have here the College of Arts and Science to make all our medical policies really suitable in a sense, because they are formed with behavior, social sciences in mind. And with that, I thank you. But yeah, there's one more thing. You know, a lot of us here are now digital natives. The children whose growth were plotted here are now digital natives. And that offers a plus side and a negative side. The plus side, and I'd like you to think of this as leaders, the plus side is now we can adapt and make a digital conversion of this book, where, given the proper data policy, can be a huge data lake. I've looked at the studies, how it is used in low middle income country, high middle income country, and even upper middle income country. Now, that is its utilization. But imagine the data here. What is the growth rate? What is the impact? What is the vaccination rate, depending on these various social determinants of health present in this book? If we can create the data lake and mine them to inform policies, then we have done our job. But there will be no more booklet to use. It will be sad. 18 years after your daughter is born, cannot show this in the debut anymore. During the wedding of your son, there's no more booklet to display and exhibit. But we have improved the lives of many children and mothers through innovation and social development. With that, I thank you very much.
Thank you so much, Dr. Michael T., Chancellor of University of the Philippines, Manila.
At this point, we would like to acknowledge the presence of Dr. Juby Purino, the Provincial Health Team Leader of Quezon Provincial DOH Office.
So again, for To introduce our first keynote speaker, may we call on Local Health Support Division Chief Dr. Maria Elena G. Castillo Gonzalez.
Good morning to everyone. It is my honor to introduce our first keynote speaker for this conference. So, Dr. Glenn Matthew Bagao is a distinguished leader in the field of public health and healthcare administration in the Philippines. He began his career in the Department of Health as the Medical Center Chief 2 of Cagayan Valley Medical Center, where he demonstrated exceptional leadership and dedication to providing quality healthcare services to the community and different walks of life towards universal healthcare. With his expertise and passion for public health, he was appointed Undersecretary and Head of the Public Health Services Cluster at the Department of Health. In this role, he oversees and spearheads various public health initiatives and programs aimed at promoting the health and well-being of Filipinos nationwide. His leadership has been instrumental in driving forward the Department of Health's efforts in addressing different public health challenges and advancing the country's healthcare system. He continues to empower healthcare professionals to make meaningful contributions to the health sector, ensuring a healthier and brighter future for all Filipinos in par with the 8-point action agenda tungo sa bagong Pilipinas. So ladies and gentlemen, Undersecretary Glenn Matthew Guillermo Bagao.
Thank you, Dr. Elena, for your introduction. I requested this podium to be moved so I don't want to be hiding from people on my right side in this big post. So, magandang umaga po sa ating lahat. First of all, I'd like to greet our guests. Of course, the organizing region headed by the regional director, Director Ariel Valencia, at the same time the Assistant Secretary of Health, and of course with the assistance of the Director 3, Dr. Leda Hernandez, and to all the people from the Calabarzon region. I'd like also to greet the local government officials, of course, headed by the Vice Governor of the province of Rizal, the Honorable Rinaldo San Juan, and the municipal mayors present, the Association of Municipal Health Officers of Calabarzon. I was also once a municipal health officer of the province of Isabela. And of course, the provincial health team leaders of the different regions of Calabarzon. I was also once a development management officer of Cagayan Valley and a provincial health officer of the province of Isabela. Different medical center chiefs present, our partners from the University of the Philippines, Manila, headed by Chancellor Dr. Michael T. our Safe Motherhood Program partners, and our international and local resource speakers. Magandang sumusulong na umaga po sa ating lahat. We would like to laud the Center for Health Development, Calabarzon, for its initiative to address crucial issues concerning the health and well-being of mothers and children in the Calabarzon region. This conference represents a significant opportunity for us with different stakeholders to share insights and explore innovative solutions to enhance maternal and child health outcomes. With the convergence of different experts and stakeholders from our international partners, may we strengthen the collaborations that will drive positive change in the health sector for universal healthcare. And as we drive for the universal healthcare, and with the 8-point action agenda of the Department of Health, of course, led by our beloved Secretary of Health, Secretary Ted Horbosa, let us maintain our commitment to prioritize the health and well-being of mothers and children. Through collective efforts and shared expertise, we can face different challenges, bridge gaps in healthcare delivery, and ensure access to quality maternal and child health services for all. I extend my deepest appreciation to our partners, sponsors, and organizers for their invaluable support in making this conference a reality. Together, let us seize this opportunity to build networks, exchange knowledge, and inspire action that will empower mothers and children to lead healthy and fulfilling lives patungo sa bagong Pilipinas dahil bawat buhay ay mahalaga. Maraming salamat at muli magandang umaga po sa inyo lahat.
Thank you very much. Undersecretary Dr. Glenn Matthew G. Bagao, Undersecretary from the Department of Health, Philippines. At this point, may we have Professor Calvin S. de los Reyes, Board Member of the International Committee on MCH Handbook, Philippines, to introduce our second keynote speaker.
It is my honor to introduce someone who is greatly influenced the cause of the Maternal and Child Health Handbook, Professor Yasuhide Nakamura. Okay. Dr. Nakamura is regarded as the father of the MCH Handbook. His name is so synonymous with the handbook that Newsweek magazine recently recognized him as one of Japan's 30 change agents. Let me tell you about his academic credentials. He is a professor emeritus of Osaka University, and after he graduated from the University of Tokyo and worked as a pediatrician at Tokyo Metropolitan Hospital, he started Global Health to encourage maternal and child health in Indonesia as a JICA expert. He also promoted the refugee health program at the UNHCR Pakistan office. He was a Takemi Fellow at the Harvard School of Public Health for International Health. He worked at the Graduate School of Human Sciences at Osaka University from 2000 to 2017. And that was where he took me under his wing. And he has been my sensei, my otosan ever since. A seasoned researcher, he is widely interested in several interdisciplinary approaches. He has been involved in the MCH Handbook programs in many countries. He is also involved in the humanitarian relief of refugees and victims of natural disasters, and was president of the Japan Association for International Health. Most recently in 2015, he got the 43rd Medical Achievement Award Irio Koro Sho. Ladies and gentlemen, fellow academics and health advocates, the father of the MCH Handbook, our beloved sensei, Professor Yasuhide Nakamura.
Calvin-san, thank you very much for your kind introduction. I'm Yasuhide Nakamura. It is my great pleasure to have as an opportunity to give the keynote presentations as a memorial first regional conference on maternal and child health, MCH Handbook, MCH in Calabarzon, in partnership with the 14th International Conference on the MCH Handbook in Manila. I have been waiting for this day for a long time. As a chair of International Committee of MCH Handbook, I would like to express my sincere gratitude to all the people contribution to this conference. Center for Health and Development, Calabarzon Department of Health, Philippines, and University of the Philippines, and thank you very much for your great effort. And yesterday, I went to, we visited Barangay Health Center and see the reality of the utilization of the MCH handbook. So, and by the interview with of nurses and mothers, and so I am very impressive about this beautiful, much more beautiful books than Japan's. It is so very good book, and in this time, this is the first time for that the international conference will be linked to regional conference organized by Calabarzon DOH. And I expect that a new horizon will be opened by the for the no one will be left behind, because so MCH handbook should be used in the spirit of self-reliance and self-determination based on primary health care approach with universal health coverage. So I would like to start. So next slide, please. Okay. This is my outline of the presentation. My experience in Indonesia and Safe Beginnings and MCH Handbook from Japan and around the world, and health and well-being of mothers and children beyond SDGs. And the next slide, please. Before starting my presentation, I would like to introduce also history of the historical review of the International Conference on MCH Handbook. And MCH Handbook International Conference started in 1998, 26 years ago, and in Tokyo. After that, we moved to many countries, Thailand, Vietnam, Bangladesh, Kenya, Cameroon, and Netherlands, Canada, and first in Philippines. And first, so in the collaboration with regional office. Okay, next slide, please. Okay. I'm a pediatrician, and after 10 years of work as a pediatrician in Tokyo, I started to work in Indonesia in rural areas. At that time, there were no electricity and no piped waters. And from a JICA expert in rural areas, 2 years I spent time in this such as a local setting. And POSHAND is a community-based organization to promote primary healthcare practice and reduce the infant mortality rate in the community. POSHAND, integrated health service post, provided integrated health services, including maternal and child health, family planning, nutrition, diarrhea, and immunization. I learned a lot of things about the reality and the spirits of primary health care. My colleagues, doctors, nurses, and health volunteers in Indonesia from the North Sumatra Health Promotion Project by JICA. Next slide, please. I enjoyed working and learning together with health professionals and the village health volunteers. And village health volunteers with malnourished children, monthly seminars. I enjoy to learn together about primary health care in the monthly seminar with village health volunteers. That's a very good experience for me. Next slide, please. And I worked in 2 years, but so under 5 mortality rate in this model village were reduced from 112 to 22 within only 2 years. It might be very easy to reduce infant mortality rate in a small village, and through the good model community-based implementation as primary health care activities. Next slide, please. Sorry, next slide, please. Universal, next, okay. WHO said universal health coverage and primary health care to build back better from the COVID-19 pandemic. WHO recommend is to reorient health system using a primary health care PHC approach. Most 90% of the essential university health UHC interventions can be delivered through a PHC approach, potentially saving 60 million lives and increasing average global life expectancy by 3.7 years by 2030. This is WHO's fact sheet said. Next slide, please. Next, okay. Primary health care, you know very well, primary health care was the key concept for health for all in Alma Ata Declaration in September 1978. Primary health care mentioned many elements such as universal, accessible, and full participation. But I'd like to emphasize in the red-colored capitals emphasis the spirit of self-reliance and self-determination. This is very important because of the significance of local government near the mothers and children are more important. Next slide, please. And in this time, so I laid safe beginnings and health and nutrition of mothers and child law in 2018 in the Philippines. This is a very good, impressive to me. And objective, improve the nutrition status, enhance the growth and development of infants and young children, provide comprehensive, suitable, multi-sectoral strategies, and create a policy environment and evidence-based intervention, and institutionalize the first 1,000 days in both national and local development plans. Yeah, I'm very impressive about this law act. Would like to bring back this act to Japan as a reference. So next, please. I'd like to say about first 1,000 days of life. The average, I was a neuropediatrician. I am very interested about child development. And average weight and height is very small. However, the size of the brain is estimated about 80% of the adult when child becomes 2 years old. And there are so many scientific evidence confirms the significance of the first 1,000 days and development, origin of health and disease, and child abuse and neglect, or so many things. But so I would like to emphasis about the first 1,000 days of life is influenced in each cultures and customs everywhere in the world. So that's why we must respect their own culture and customs when we consider the first 1,000 days. Next slide, please. This is Japan. Traditions persist regarding pregnancy and childbirth and child care because long before the development of modern medicine, people become pregnant. And someone in the community assisted with the birth. And family, relatives, and community members provided child care support until the child grew up. So that's why we must consider such a culture and customs. Japan also a country with a unique view of disease from the global viewpoint. This is Emiko Onuki is an anthropologist said maternity birth or the custom visiting shrines, or this is Japan's cultures. And maybe in Philippines also you have so many culture and customs. And we must respect these cultures, but we'd like to introduce to change their behavior. So, next slide, please. And this is 11th International Conference on MCH Handbook at Bangkok. And Sarawat-san, yeah, please stand up. Yeah, Sarawat-san is also chairperson of that time. So at that time, there are so many participants from 29 countries, 2018. And next slide, please. And at that time, we have a Bangkok Declaration. Bangkok Declaration said MCH Handbook was published, Bangkok Declaration mentioned that the MCH Handbook is an essential and effective family-based tool that can promote continuum of care for all mothers and children, especially during the important first 1,000 days of life. MCH Handbook should promote early child development to ensure well-being throughout the course of life. So I think based on the Bangkok Declaration in this time, main theme is safe beginning. It is also very similar in Philippines. Yeah. Next slide, please. And from Japan, Michael Lee-san, Chancellor, UP Manila already mentioned, MCH Handbook was first published for the first time in the world in 1948. Characteristics of MCH Handbook is a combined health record of both mother and the child health information kept at home. The pregnant mothers can get the MCH handbook during pregnancy. The healthcare record of pregnancy, deliveries, neonatal care, child growth, and immunization were written by nurses and doctors. The coverage is almost 100% in Japan. Most parents keep MCH handbook until their children are married. Next slide, please. This is a continuum of care. There are so many programs to improve maternal and child health in Japan, as similar as many countries. These interventions are carried out in different times, at different places, and by different healthcare professionals, medical doctor, dentist, nurses, midwife, public health nurses, nutritionists, etc. It is easy to say the continuum of care in rhetoric. However, it is very difficult to ensure the continuum of care. MCH handbook in Japan can guarantee the continuum of care. And the next slide, please. This is a beautiful handbook. East Timor, Vietnam, and Afghanistan, and so today also so many countries from African countries and Asian countries and Central Asia, and so maybe we can get much more information in afternoon session. And the next slide, please. And Anne from UNICEF already mentioned strengthening implementation of home-based record for maternal and newborn and child health. WHO, UNICEF, and JICA publish many guidelines and strengthen the implementation of home-based record of. This is maybe this afternoon. Miss Keiko Osaki from JICA will explain the details. Next slide, please. And in 2018, I would like to say to you, especially for the medical doctor, I would like to inform World Medical Association statement on the development and promotion of a MCH handbook. And because of the World Medical Association recommend MCH handbook or equivalent in order to leave no one behind with respect to SDGs, especially for non-literate parents, migrant families, refugees, minorities, peoples in underserved and remote areas. World Medical Association recommend MCH handbook. Please bring back this one to your own countries. Next slide. This is a MCH handbook integrated. This is a 13th International Conference on MCH Handbook Toronto. 2 years ago, we have a conference and in Toronto. At that time, there were many collaborators, WHO, UNICEF, UNFPA, and JICA. And next slide. And the Toronto Declaration said, MCH handbook integrate diversity, equity, and inclusion principles into healthcare. This also new concept. Diversity, equity, and inclusion. This is a very important factors to promote maternal and child health. And the MCH handbook is very useful in this viewpoint. Okay, next slide, please. And the next is a paper and the digital ones. Information and communication. Now there are many new trials of information and communication technologies started. in relationship with MCH Handbook. Paper style and digital style have a common characteristics. To get it easy during pregnancy, to keep it at home, to manage a health record by themselves. It is a common characteristics. But paper MCH handbook is especially the handwritten text is very heartwarming. Yeah. And the digital MCH handbook is a younger generation have a high affinity for apps and SNS. So we must consider both. Next. Next is a new science and planetary health. In 2022, 2 years ago, WHO's World Health Day's main theme is our planet and our health. And then COVID-19 has fundamentally shaken the state of the global health. And we must consider about not only for the human health, but also for the health of the earth, health of the, our planet. Next slide, please. And planetary health, Lancet. Mr. Horton, the editor-in-chief of the Lancet, wrote a paper of the planetary health in 2015. He quoted the sentence of the Wendell Berry, and American novelist and environmental activist. He said, we have lived our lives by assumption that what was good for us would be good for the world, but we must change. What is good for the world will be good for us. So, and we must consider the environment much more. And next slide. And so that's a planetary health needs a transdisciplinary or cross-disciplinary approach. New discipline expected to cover many disciplines. Next slide, please. And this is a MCH in the era of the planetary health. Planetary health is, this is a Mount Miwa, is in Japan. It's a very small mountain, but so a mountain is a good itself. The community respect all the trees, plants, and animals in the mountain. And as the same as the planetary health is a new disciplinary approach during and beyond SDGs, especially for the life course approaches, such as health and well-being of mothers and children and families, and indigenous people in the world, as same as like so older people in Japan have a similar idea. What is good for the world is good for the health. Next. Next is in the final of my presentation, I would like to show you the one or two slides. So from the Gaza of the Palestine. And it has been 15 years since the introduction of the MCH handbook in Palestine. And JICA, UNRWA, and I also visited Palestine. And in June 2023, Palestine and Japanese mothers using MCH handbook had a wonderful online discussion connecting Gaza and Japan. We discussed about the child health. It's only, but so just after this wonderful event, so we now saw a very serious situation in Gaza. And so this is a new photo as a passport of life. A photo by Dr. Seita, or our colleagues in UNRWA. A 1-year-old boy has taken refuge in Rafah, a city in the south of Gaza. The building of his house in the north was bombed, but his family managed to keep everyone safe. His mother returned to the rubble and dug out her MCH handbook and brought it with her. So, and MCH handbook is a kind of the life passport in Gaza. And next, as a friends of WHO Japan, I would like to introduce the constitution of the WHO. Maybe you know, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. But another sentence is the health of all peoples is fundamental to the attainment of peace and security, and is development upon the fullest cooperation of individuals and the state. So in this time, so I'm very happy we are come together in Manila, and so we are cooperation with health and mothers and children in consideration of maternal and child health handbook. And I think so we appreciate such a fullest cooperation of individuals and the state. Next slide, please. Thank you very much for your kind attention, and salamat po, and arigatou gozaimashita.
Thank you so much, Professor Yoshihide Nakamura. Again, from a chairman from International Committee of MCH Handbook. At this point of our program, we will be awarding a certificate of appreciation to our key, speakers
First
and
keynote
supporters.
speaker. So may we invite on stage the following. Let's have the Assistant Regional Director of the Center for Health Development Calabarzon, Dr. Leda M. Hernandez.
And also Local Health Support Division Chief, Dr. Maria Elena Castillo Gonzalez.
We would like to call on also Ms. Racel G. Carion, Chief Administrative Officer of the Management Support Division.
Family Health Cluster Head, Dr. Mark Nicolas Santos.
May we also invite Dr. Monica Jennifer Victorino, Chief of the Regulation, Licensing, and Enforcement Division, CHD Calabarzon.
And also Regional Safe Motherhood Program Manager, Ma'am Vanessa Bebida.
And of course, Dr. Hatsumi Noda, Maternal Health Medical Coordinator.
Okay. Let me read the citation of the certificate. Certificate of Appreciation is awarded to
Undersecretary Glenn Macho G. Bagao.
In profound appreciation and admiration for your exceptional contribution as the keynote speaker during the Safe Beginnings First Regional Conference on Maternal and Child Health, MCH in Calabarzon, in partnership with the 14th International Conference on the MCH Handbook, given this 9th day of May 2024 at the Lime Resort in Pasay City, Metro Manila, Philippines, signed by Assistant Secretary of Health, Ariel I. Valencia.
Thank you very much, Undersecretary Bagao. May we have again on stage Undersecretary Bagaw to present the certificate of appreciation to Professor Yoshihide Nakamura in profound appreciation and admiration of his exceptional contribution as the second keynote speaker during the Safe Beginnings First Regional Conference on Maternal and Child Health MCH in Calabarzon in partnership with the 14th International Conference on the MCH Handbook, given this 9th day of May 2024 at the Lime Resort in Pasay City, Metro Manila, Philippines. Signed, Ariel I. Valencia, Assistant Secretary of Health.
May we request Prof.
Hindi, sige.
May
May we
request,
request
Prof.
Professor Nakamura to stay on stage for the awarding of Certificate of Appreciation to Dr. Isabel Gonzalez Andres.
In profound appreciation and admiration for your exceptional contribution for giving message of support during the Safe Beginnings First Regional Conference on Maternal and Child Health, MCH in Calabarzon, in partnership with the 14th International Conference on the MCH Handbook, given this 9th day of May 2024 at the Lime Resort in Pasay City, Metro Manila, Philippines. Signed, Assistant Secretary of Health, Ariel I. Valencia.
Pabigay na rin po kay Dr. Ana. Okay. Another certificate of appreciation is awarded to Ms. Noriko Komatsu in profound appreciation and admiration for her exceptional contribution for giving message of support during the Safe Beginnings First Regional Conference on Maternal and Child Health in Calabarzon in partnership with the 14th International Conference on the MCH Handbook, given this 9th day of May 2024 at the Lime Resort in Pasay City, Metro Manila, Philippines. Signed, Dr. Ariel I. Valencia, Assistant Secretary of Health.
The certificate of appreciation is also awarded to Mrs. Seiko Noda, represented by Ms. Kamatsu.
Another certificate of appreciation will be awarded to Honorable Reynaldo San Juan Jr., Vice Governor of Rizal Province, in a profound appreciation and admiration for his exceptional contribution for giving message of support during the Safe Beginnings First Regional Conference on Maternal and Child Health in Calabarzon. This is in partnership with the 14th International Conference on the MCH Handbook, given this 9th day of May 2024 at the Lime Resort in Pasay City, Metro Manila, Philippines. Signed, Dr. Ariel I. Valencia, Assistant Secretary of Health.
Certificate of appreciation is awarded to Dr. Sumiri Sorano in profound appreciation and admiration for her exceptional contribution for giving message of support during the Safe Beginnings First Regional Conference on Maternal and Child Health, MCH in Calabarzon, in partnership with the 14th International Conference on the MCH Handbook, given this 9th day of May 2024 at the Lime Resort in Pasay City, Metro Manila, Philippines. Signed, Assistant Secretary of Health, Ariel I. Valencia.
Now let's proceed with the awarding of Certificate of Appreciation to Dr. Michael L. T., Chancellor of the University of the Philippines, Manila, in profound appreciation and admiration of his exceptional contribution for giving message of support during the Safe Beginnings First Regional Conference on Maternal and Child Health in Calabarzon. This is in partnership with the 14th International Conference on the MCH Handbook, given this 9th day of May 2024 at the Lime Resort in Pasay City, Metro Manila, Philippines. Signed, Dr. Ariel I. Valencia, Assistant Secretary of Health. Any representative of Chancellor T to receive his certificate of appreciation? Doc, may we invite you on stage? Dr. Dr. Imperial.
Thank you so much. Certificate of Appreciation is awarded to Professor Calvin S. De los Reyes in profound appreciation and admiration for his contribution during the Safe Beginnings First Regional Conference on Maternal and Child Health in Calabarzon, in partnership with the 14th International Conference on MCH Handbook, given this 9th day of May 2024 at the Lime Resort in Pasay City, Metro Manila, Philippines. Signed, Assistant Secretary of Health, Ariel I. Valencia.
May we invite a representative of Professor Calvin S. De los Reyes to receive his certificate of appreciation. Dr. Professor Hernandez from UP. Thank you very much.
Thank you so much. So let us now, sir, let us now proceed to a photo opportunity.
Yeah, we
So
will proceed with our photo opportunity. So may we invite our photographers here on stage. So our participants will be moving towards the center. Okay? So they will be facilitated by our CHD staff and the staff of Lime Hotel. So they will be moving towards the center. Our photographers will be here on stage to take the photos.
Again, all photographers will be here on stage.
Yes, ma'am.
Yes.
Compress, yeah. So may we invite our participants to come on the center part of our venue, of our hall.
For the group photo opportunity.
Yes, for the photo opportunity. May ganyan na ba? Sila. Ay. Hindi, doon muna. Oo, oo. Oo. Dito pa. Again, may we invite our participants to come on the center part of our hall for the photo opportunity. So lahat po.
Everyone po.
Yes po.
So may we invite everyone po
Yes.
for the group photo opportunity po.
Yeah,
So again,
so some will be at the center, some will be on this side, others will be at that side of the hall.
yes po. Okay po.
Again, may we invite others to join our photo opportunity. Yeah. Please feel free to occupy this center space. I think we have some more available space here. Yeah.
Kasha po ba?
Kaya hindi kita yung iba. Yes, thank you very much for joining our photo opportunity. Maraming salamat po. Yan muna. Okay.
Tapos,
ano na, lunch na tayo. Oo. Tapos yung napag-usapan, di ba, yung parang may mga assigned per table na lalapit. Okay, thank you.
Okay, at this point, I think we're ready to have our lunch. I think there's some guidelines, some patterns for the serving of our lunch. Can you share with us, Ma'am
so again,
Arlene?
for table 1, 3, 4, 18, table 10, and table 11, they'll be getting their food inside on the right side of the venue.
Yeah, okay. We repeat for the participants occupying table number 1, 3, 4, 18, 10, and 11, you will be getting your lunch from the buffet on your right side.
Right
Yeah. So again, participants occupying tables number 1, number 3, number 4, number 10, 11, and 18. Again, you will have your food from the right side of this hall. And for tables occupying
Table two.
participants occupying table number 2, number 8, number 9, number 15, and number 17, you will have your food from the buffet located outside of this hall. And for tables for the participants occupying tables number 5, 6, 7, 12, 13, and 14,
we will be serving.
yeah, your lunch will be served to you. Again, for the participants or for our guests occupying tables number 5, number 6, number 7, number 12, number 13, and number 14, your lunch will be served this afternoon. Again, we will repeat for the guests occupying tables number 2, number 8, number 9, number 15, and 17, your lunch will be served from the buffet set up outside our hall. Thank you.
May photo opportunity.
Wait lang, Sir Paul. Sir Paul. Sir Paul. Nagre-request yung mga international magpa-picture dito sa baba.
Members ng with USEC. With USEC, baka sila.
International.
Kasi, unahin muna natin lahat ng CHP Calabarzon organizers. Kasama si USEC kasi aalis na. Sabi ni Doc Mario.
May we invite all the CHD Calabarzon 4A staff and personnels to join us here on stage together with Undersecretary Bagao for an official photo opportunity. Again, all the employees of the CHD Calabarzon 4A together with Undersecretary Bagao here on stage for a photo opportunity. And then I think it will be followed by a
Our
photo opportunity
international
requested by the members of the international
delegates.
yes, international delegates, members of the Maternal and Child Health Handbook.
Handbook. So again, we are calling the
Again, all our CHD4A employees with USEC Bagao. May we invite again our CHD4A employees, officials, staff,
including also
and PIDOOs as well,
PIDOOs.
and the provincial DOH offices to please join us here on stage together with USEC Bagao for photo opportunity, and also UP Manila interns, our College of Public Health interns from the University of the Philippines, Manila, to join us. Yan. And also the PIDOHO representatives. Dun po yun. Sa baba, sa step. Ayan, sa step po. Dito tayo.
Okay. UP interns, pwede po tayo sa harapan. Upo po tayo. Compress po tayo ng konti. Ayan. Taba. Sasak ako. Thank you so much po.
One more. So we will do sa bagong Pilipinas, bawat buhay mahalaga. So video, it will be taken in video. Buhay mahalaga. Yeah. One more. Louder. Louder. Sa bagong Pilipinas, bawat buhay mahalaga.
Okay.
So thank you very much, CHD Calabarzon.
Yes.
Apo.
Okay.
So at this point, may we invite the members of the
International
Committee
MCH
of the Maternal and Child Health Handbook. Again, all the members of the International Committee of the Maternal and Child Health Handbook here on stage to have your photo opportunity. May we invite Professor Calvin
as
you
well.
are being invited here. Calling all the members of the International Committee on the Maternal and Child Health Handbook to be here on stage for photo opportunity. Our international delegates from different countries.
Sir, again,
Sir
Professor
Calvin,
Calvin.
yes. And all the other members present here, members of the International Committee of the Maternal and Child Health Handbook, please join us here on stage for a photo opportunity. I think we're ready to have our intermission number while we're having lunch. So our intermission number will be a song number, a duet by Mr. June De La Cruz and Miss Maria Luisa Dalida. A round of applause for our performers this afternoon. Mr. June De La Cruz is one of our interns from the University of the Philippines, Manila, and while Miss Luisa Dalida is from our Family Health Unit.
There are times when I just want to look at your face with the stars in the night. There are times when I just want to feel your embrace in the cold night. I just can't believe that you are mine now. Dream that I once knew. I never thought I would be right for you. I just can't compare you with anything in this world. You're all I need to be here with forevermore.
All those years I've longed to hold you in my arms. I've been dreaming of you. Every night I've been watching all the stars that fall down, wishing you would be mine. I just can't believe that you are mine now. You were just a dream that I once knew. I never thought I would be right for you. I just can't compare you with anything in this world. You're all I need to be with forevermore. Time and again, there are these changes that we cannot end. As sure as time keeps going on and on, my love for you will be forevermore. dream that I once knew. I never thought I would be right for you. I just can't compare you with anything in this world. You're all I need to be with forevermore. We'll stay together. You're all I need to be with forevermore.
For the millions of chick enjoyers.
Kung ika'y magiging akin, di ka na muling luluha pa. Pangakong di ka lolokohin ng puso kong nagmamahal.
Kung ako'y papalarin, na ako'y iyong mahal na rin. Pangakong ikaw lang ang iibigin magpakailanman. Di kita pipilitin, sundin mo pa ang iyong damdamin. Hayaan na lang tumimbog ang puso mo para sa akin. Kung ako'y mamalasin at mayroon ka ng ibang mahal, ngunit patuloy ang aking pag-ibig magpakailanman.
Di kita pipilitin, sundin mo pa ang iyong damdamin. Hayaan na lang tumibok ang puso mo para sa akin.
Kung ako'y papalarin, na ako'y iyong mahal na rin. Pangakong ikaw lang ang iibigin magpakailanman.
Di kita pipilitin, sundin mo pa ang iyong damdamin. Hayaan na lang tumibok ang puso mo para sa akin. Di kita pipilitin, sundin mo pa ang iyong damdamin. Hayaan na lang
Mamaya.
Good afternoon. We hope that everyone already had their lunch. And may we request our guests and participants to please settle on your seats as we will begin in a few minutes. Thank you. Good afternoon. We will continue our conference in a few minutes. Thank you. Okay, good afternoon. Currently, we're presenting to you this QR code because after in this afternoon, we will have the part of our program will be the sharing of global experiences on maternal and child health and the MCH Handbook. So each of our presenters will be given 15 minutes for their presentation. At the end of all the presentation, we will have a plenary and open forum. So if you have your questions, kindly scan the QR code and then you can share your questions via the QR code, which will be read during the plenary and open forum. It will be answered by our presenters. Thank you. Again, for the information of all of our guests and participants, we're currently showing you this QR code, which you can use to send your questions. Because this afternoon, we will be have part of our program will be the sharing of global experiences on maternal and child health and the MCH Handbook. So we will have different presenters coming from different countries. And then we encourage everyone to post your question using this QR code. So if you have your questions or inquiry, please scan this QR code and then type your questions. We will answer the questions later on during the plenary or open forum. Thank you. Good afternoon. Again, we encourage everyone to scan the QR code currently being flashed here on our screen. So this will be your way to share or post your question, which will be read and answered during the plenary or open forum. So this afternoon, we will be having the sharing of global experiences on maternal and child health and the MCH Handbook. We will have several presenters coming from different countries. So if you have your questions, kindly scan the QR code and please feel free to post your question so we can answer them later on. Thank you. Again, we will start our session in 4 minutes. We will begin the afternoon session in 4 minutes. So may we request everyone to kindly settle down on your seats and prepare for the afternoon session. Thank you.
Papakita ko na sa nanay ko. Matutuwa na naman si nanay. Yung dati ko din lagi nagiging ng picture, hindi pala ako nakakapag-picture lang. Grabe ka, yun na nga lang yung sorry naman na kaya mong ibigay para matuwa mo ka magulang. Hindi mo pag ginagawa. Kay Ninoch ka pala. Iba't sa SMP 2024 pinag mali. Dun sa tutuwa yung nanay ko dito. Ay, si Nini. Wala na time sa akin. Si Nini, busy. Cellphone to ni ano? Sir Ando.
Again, we encourage everyone to please settle down on your seats as we will begin in 1 minute. Thank you.
Parang yung design niya nag-blend din ng loob. Galing. Talaga yung binase namin talaga sa loob. Talaga. Ay, oo, grabe. Nakita niyo na ba yung ano, supsupan? Nakita ko na yung supsupan. May ano, go-go. Tsaka naman ako. Yung, di ba, kinasal kasi siya kahapon. Nakita mo yung supsupan nila ng asawa. Hindi, ang galing. Supsup na supsup talaga. Uy, kanina mo yun. Awkward naman. Nakita ko na galing. May kita mo, gumagano yung bibig ng lalaki. Lalaki si Gogyo? Oo, wala yun. May asim pa. Maasim na maasim. May libido pa. Ay, ba tayo kasama? Oo, 50 years younger na. So, 30 years old? 18 siya. Love is in the Love is blind.
Hello again. Good afternoon, everyone.
Yeah, and welcome back to the second part of our conference of the Safe Beginnings, the first regional conference on maternal and child health in Calabarzon. This is in partnership
With the
with the
14th
14th
International
International
Conference
Conference on
on
the
the MSH
Handbook.
MCH Handbook.
Yes. Okay. So at this afternoon,
We will continue our program with sharing of the global experiences on maternal and child health and MCH Handbook.
yes,
So-
and we will be providing 15 minutes for every presenter.
So again, we will be providing 15 minutes for every presenter.
And after all the
Presenters.
presentations, we will allot another 15 minutes for the plenary and plenary slash open question and answer. So all of the questions collated earlier while we flash the QR code will be answered later on.
So again, we will entertain at least 3 questions from our face-to-face participants and another 3 questions from our online audience.
Yes. And may we request to our participants, if you will pose your question, kindly state your name, your designation, your affiliation, and to whom you would
you
address your
their
inquiry. Okay. So I think we're ready to begin this afternoon session. We will begin the sharing of the global experiences on maternal and child health and the MCH Handbook with Dr. Sarawut Bunsuk, Inspector General from the Ministry of Public Health, Thailand. A round of applause for Dr. Sarawut Bunsuk.
Okay. Good afternoon, ladies and gentlemen. Professor Nakamura, distinguished guests, and all participants from another country and the Philippines. Today, I would like to share about the experience of the MCH Handbook in Thailand. On behalf of the Department of Health, Thailand, Ministry of the Public Health. Today, I would like to talk about the next slide. The next slide. Okay. Today, I would like to talk about the situation of the mother and children in Thailand, include of the law of the Pink Book or MCH Handbook, and maternal and child care in Thailand. And Pink Book application is like a digital handbook in Thailand. The final, I would like to share about the experience of the result of the MCH situation and evaluation in Thailand and challenge and the next step in the future. The next slide. About the situation of mother and children in Thailand. The next slide. From this slide about the data from the World Health Organization show about the total fertility rate by the country. I think it's the same, the country in the world face of the problem about the birth rate. Also in Philippines, Japan, Canada, as well Thailand, is have the problem in that this time. For Thailand, total fertility rate is about 1.1%. That means in the future, we have to face about the problem of the security, human security. I think it's important issue, but how we deal about this situation. The next slide. The next slide. About the pyramid, population pyramid in Thailand, I think same in the ASEAN country, we increasing of about the elderly people. Birth rate in Thailand for 10 years ago rapidly decreasing. But in this time, we promote to the national agenda for the collaboration with another ministry for the improve about the strategy, activity for deal about the low birth rate. Not aspect of the healthcare, but we discuss about the another aspect about the security, human security, economic scale. Yes, depend on the human resource in the future. The next slide. About the key indicator important in the world, maternal mortality ratio, I think there is some problem and very problem in developing country as well as Thailand. But in Thailand, maternal mortality ratio is a decreasing rate in this time. For the last year, we found about the MMR about the 21 per 100,000 live births. In the last year, the MMR is rapidly increasing due to COVID-19, but in this year, slightly. I think in some countries have to face this problem. But how we can to cope about the MMR, Maternal and Child Health Handbook, can help all of them. I think share to you in about the result of the Thailand in this year. The next slide. This slide shows about the low birth weight. Low birth weight in Thailand it have the problem. The data on the World Health Organization in year 2020, low birth weight in Thailand about 10%. But the indicator for the Thailand, we set the goal for the less than 7%. It's a long time we cannot deal about the low birth weight. I think the little baby handbook from the Bandosang can help all of them. But in Thailand, we try to promote about the 1,000 miracle day, from the little handbook in the future. The next slide about the active breastfeeding rate. In Thailand, from the mixed survey and the World Health Data Organization, we find about 14%. But the data may be not accurate because of the methodology for the survey or something like that. But in Thailand, we use the 24-hour record answer for the survey. But we found it's very low for the active breastfeeding. Although in Thailand promote about the formula for the Best Meal Act for 10 years ago, but we can scale up about the breastfeeding maybe about 14%. The next slide. About the malnutrition, I think Thailand is have the problem too. We found about 7.7%, maybe in the same in the country, in the ASEAN country. And the next line. The next line. About the overweight, in Thailand, we found that the children age preschool age found about the overweight rate. Overweight. In Thailand, it is the third of the ASEAN country face of the problem about the overweight and increasing for the NCD in the future. How will we will to deal about the overweight in the future? I think the important issue, how to use the MCH Handbook for guideline of promote about health literacy for the parents to all of them. The next slide. The stunting also, maybe I think it's the same in the country. The next slide. The next slide. About the law of the Pink Book in maternal and child care in Thailand, I think it's an important issue that Professor Nakamura talked about the evolution of the Pink Book in the world, include of the Thailand too. The next slide. Okay. This slide shows about the background of the maternal and child health milestone in Thailand. We start in the year to 1985, we developed the MCH Handbook, first development in that this time, only 10 page. And in year 1992, we promote about the baby friendly hospital initiative by use the MCH Handbook for the guideline recommendation or something like that for the doctor and nurse to care of the children and give the promotion to the parents. And in 1994, we promote and scale up the thalassemia screening and diagnostic test in the antenatal clinic. We use the MCH Handbook for the screening thalassemia, but test at the healthcare center in the village through the MCH Handbook. And in 1998, all public hospitals have been certified as a bed-feeding hospital initiative hospital safe motherhood project. And then in the year 2015, MOPH committed to the address child development in well-child clinic, and children receive regular development screening from the health personnel from the guideline of the Royal College of the Pediatricians of Thailand. The next slide. This is the evolution of the MCH Handbook in Thailand. Many years we developed about the MCH Handbook, but in the last year we tried to we developed the MCH Handbook for the 5 language for the minority in Thailand, especially for the neighbor country near Thailand, Myanmar, Cambodia, and Laos, PDR, and Vietnam, and give for free to all of them if all of them live in Thailand and border. The next slide. The current MCH Handbook in Thailand, we also have the pink book. It's like the health record, the screening result, information for the self-care and the health promotion. And we include about the 2 development screening book for the development surveillance and promotion manual for normal child. Because this is important for the development surveillance in Thailand, we found that the child at the 5 year face of the problem of delayed development, especially for the language aspect. It's important, and we try to develop the assessment for the intervention manual for high-risk children. It's important because of the low birth weight in Thailand is so high, but we have to the guideline for the development assessment for the intervention manual for the high-risk baby. The next slide. The infrastructure of the MCH health services in Thailand, we try to promote about the strategy, especially for the availability. There is the one hospital for each district, almost about the 1,000 hospitals throughout the country in Thailand. And accessibility, universal health coverage scheme provide benefit package for the pregnancy and the childbirth, well-being, clinic services. All of these services is free for the Thai government and the vulnerable group in Thailand. About the quality of the service delivery, the hospital provide the case according to the national standard. In Thailand, we have the recommendation and the standard for the maternal and child health. And we give the recommendation to all of the hospital in Thailand for the practice and the implementation. Each one have the important health data center. How we can to the collect the data from the each of the hospital, include of the private, public sector, we can try to the routine hospital-based electronic record. This year, we promote 30 baht scheme. Can use ID card for the Thai people, go to anywhere hospital in Thailand and can free and can no record from the paper, but we use the electronic record. Is the home-based medical record. Also, I would like to talk about the digital platform in Thailand. The next slide. This is the picture about the nurse distribute MCH handbook in Hill-Tip community. In Thailand, in the border of Thailand, we face of the problem about the MMR, maternal death, and children death, baby death, because of the long time for referring from the rural to the district. This is important. We use this project to all of them. The next slide. The next slide. This is the promote of the 1,000 day, miracle day, and encourage the use MCH handbook to the parental school services. The next slide. The next slide. I would like to talk about the digital MCH handbook in Thailand. The next slide. The next slide. This is the application. We have the T pillar. The first one is the open and connect. The second, the citizen-centric and the high performance. How we should collect the data to all of them. The medical doctor and the people can use this data to the mobile phone. This is the digital handbook. The next slide. Okay, this is the handbook application. Okay, I think it's very, very important in Thailand. The next slide. The next slide. And from the Citizen MCH handbook or Pink book integrate into the health book application. We have the application by the smartphone. The parent can use the smartphone for the record and the share information to the medical doctor and nurse in the hospital or the healthcare services center. The next slide. The key success factor, we have the three main issue. The first one is the technical DOS because of the about the standard of the healthcare services in Thailand for a long time. And Financial National Health Security Office can support about the funding and budget to all of them free, no charge for the healthcare services to all the people in Thailand and provide the health facility in Thailand. This we work together. It's like the country ownership, participation from the user and the partner. We can to work together. The next slide. Okay, the challenge and the way forward. The next slide. I think if we have to the success in some point, but we have the problem, especially about the increase the use of the MCH handbook or the MCH application to increase health literacy provide to pregnant women. How we can promote health literacy to the MCH handbook, not for the medical doctor, but have for the parents or the people in the village. And the second, increase the accessibility of the MCH handbook for vulnerable population in Thailand. Is an important issue. And the connection of data and monitoring of the high-risk pregnant women to decrease the ratio of the maternal death is an important issue we have to move forward in the future. The next slide. Thank you so much for sharing experience from Thailand. But I think if you have any question, my colleagues from Thailand, Dr. Chuiwan and Ajahn can you give the answer to all of you? Thank you so much.
Thank you very much, Dr. Sarawut Bunsuk, the Inspector General from the Ministry of Public Health Thailand, for your presentation. Now we will continue with...
For the MCH Handbook in Indonesia, from University Secretary, Universitas Indonesia, Professor in the Faculty of Public Health. Let us all welcome Dr. Agustin Kasumayati.
Thank you. Good afternoon, everyone. It's really an honor for me to have the opportunity to be here with you and share the situation of MCH Handbook utilization in Indonesia. So, next slide, please. So, the name of MCH Handbook in Indonesia is Buku KIA. Next slide, please. This is a short introduction of myself. Next slide, please. Okay, this will be the content of my presentation. First is about a little history about Buku KIA. The buku means book. KIA is Kesehatan Ibu dan Anak, Maternal and Child Health. And then the current version of the Buku KIA, and then the utilization, and then last but not least, rooms for improvement. Next slide, please. History of MCH Handbook. Next slide. So we start in 1994 with the help of JICA from Japan. Professor Nakamura and his team came to Indonesia, introduced the MCH Handbook, and proposed to use the MCH Handbook as the replacement of many cards that we have at that time. We have immunization card, growth chart card, maternal cards, and so many other cards. So we put together in one book at that time. It's in 1994. We did a very good scenario to prove the advantage of using MCH Handbook. We did the baseline survey, inline survey, as well also the midline survey and endline survey, and then to show the advantage of the book. And finally, in 2004, we came to the decision to only use this MCH Handbook as the record for maternal and child health. So all the health personnel at the primary care level use this MCH Handbook. So this book is revised every 5 years. So until now we have 4 versions of the book. The current one is the 2020 version of the MCH Handbook, of the Buku KIA. And our government is fully committed, fully funded the printing of the book and distribute the book all over the countries. However, in the survey, national survey in 2016, we also found that local governments also have a good commitment on using this book. About 1/3 of the provincial government commit to print and distribute the book, and about 45% of the district governments also commit to use the book. As for information, we have 38 provinces in Indonesia and 514 districts in Indonesia. So we are very, very big actually. So we have several national research, basic national research, and in this research we try to get information about the utilization of the handbook. So we see this is 2 national research in 2013 and 2018. And then in 2013, we found that about 81% of pregnant mothers, they have handbook. They have the handbook. And then unfortunately, only 53% of under 5 had the handbook. Again, unfortunately, among pregnant mothers, only about 50% of them bring their handbook when they get antenatal care. So even they have the handbook, but the utilization is not as what we expected. In 2018, there is a slight difference of the ownership of the handbook, both among mothers and under 5. And then only 10% are fully filled by the health personnel as well as by our voluntary health worker. So the handbook is there. It's owned by the mothers. It's owned by the children, but it is not well utilized. Okay, next slide, please. Now let's see. This is the very current result of our National Health Survey in 2023, last year. The survey was done last year. Next slide, please. This is the current version, the 2020 version. If we have the book, we have two covers. So in one cover, there is for pregnant mothers, and then the other covers is for under 5. So the baby was already delivered at that time. So in one book. Next slide, please. So the book basically consists of recording parts as well as also information part. Recording parts for the mother includes, for example, iron supplementation, planning, birth planning, and then antenatal care, weekly monitoring of the pregnant mother, and then monitoring during postpartum period, and then record of the delivery process, record of the postpartum situation. And then if there is a referral services needed, there is also a record in that book. It's the record part. The information part include also information about pregnancy, about mother class, about nutrition of the mothers during pregnancy, and then the process, delivery process, the postpartum period, as well as also breastfeeding. Breastfeeding is also informed in the mother's part because we expect the mother prepare themselves for breastfeeding. Last but not least, family planning. So these are all information that available in our current version of Buku KIA. Next, please. This is the record and information for the under 5. The record includes neonatal care, and then a growth chart, and then supplementation, vitamin A, antihistamines, and etc. And then development monitoring. Immunization, any records of children's sickness, and then a very records of the daily monitoring of the neonatal. And then last but not least, weekly monitoring of the under 5. About the information, we provide information about nutrition, about any symptoms that have a very significant meaning, for example, and then of course development of the children up to 5 years old. Next slide, please. Okay, now the utilization. Next slide. This is the result of our last year's survey, national survey. For the mothers, our sample are mothers who are having babies already between January 2018 up to the survey period. So those the criteria of the mothers. So 71% of them never attend mother class. So mother class, we develop mother class as the part of the MCH Handbook. Because without mother class, it is difficult. It is also already found, it is difficult to Indonesian mother to understand the book. So that's why we provide counseling, communication, information via mother class. But 70% never attend. Another 21% attend, but only less than 4 times. Not complete knowledge. Those who complete 4 times or more, only 8%. Only 8%. Okay. Only 1/3 of them are accompanied by their husband, were attending this mother class. Next slide, please. Still among the mothers. Why? Why don't you attend the mother class? Some of them said because it's pandemic. Okay, because we started those who already delivered the baby in 2018. Yeah. And then 42% said that they do not know about the mother class. They do not know about the mother class. About almost 6% have the problem with the distance, with the difficulty in transportation. Another very small proportion, they are not allowed by their husband. 20% are not interested. 20%. They are not interested. 1 point, almost 2% said it's too long. The session is too long. So these are the reasons why they did not attend the mother class. Next slide, please. Now, this is, we select as our sample under 5, 0 to 59 months. And then 18.8% of them do not have MCH handbook. Some ever have, already disappeared. Some others, never. The other, they have the MCH handbook. About 33%, the recent version, 2020. 37% other version, maybe the older version. Some of them also get MCH handbook from made by other, let's say by hospitals, private hospital, but not by our Ministry of Health. Only 0.5% have digital MCH handbook. So this the coverage of digital MCH handbook is still very, very low. But among those who claim that they have the MCH handbook, almost 10% they cannot show the MCH handbook. Okay, next slide, please. Under 5, okay, about 87 feel completely the identification, the many information, but 17.5% incomplete, about 4% no data at all in the MCH handbook. They have the handbook, but there is no data. Next slide. What have been recorded? First, about pregnancy history, only 63.3% complete. About birth history, 64% complete. Sickness, 37% complete. Growth monitoring, only 61% complete. Growth monitoring, this is very important. And then development monitoring, even lower, 33% complete. So this is the utilization of MCH handbook. Next slide, please. Actually, I want to say the good thing about my country, but this is the result of the survey. So I have to share also this situation. Okay, when we ask, when they receive information about child health, did the, let's say, health personnel or voluntary health worker use the MCH handbook? 77% said yes, they used the handbook. But the others said no. So the utilization of the handbook for communication, information, and education also to some extent should be increased, should be make it better. Next slide, please. Next slide, please. So this is room for us for improvement. Next slide. The first thing is very important is to improve utilization by the health personnel itself, themselves. This is very, very important. So many ideas already discussed. Among others is to introduce MCH handbook during the education, pre-service training, and also in-service training. The second one, but includes not only midwife, but also nurse, doctors, obstetrician, pediatrician, yeah. And then the next also improve the utilization in the hospital, because now the book is only used at the primary health care, not in the hospital. And it's also not mandatory use in private hospitals. So I think this is the room for improvements. The other thing also, how we can improve the use of the book by the voluntary health workers. Of course, one, the health personnel should use, and then ask the voluntary health workers to use also. Mass promotion of MCH handbook, not only to mothers, but also to fathers, to community leaders, to any organization. Promote and intensify mother class. This is very important. Mother class and under 5 class. This is very important. And last but not least, since I just have the new national data, I suggest to do deep analysis on the data to see really the relationship between the use of the handbook and the current status of the health and outcome of the health of the mother and children. So, next slide. Thank you so much for your attention. This is the story from Indonesia. Using MCH Handbook, it's not easy, it's challenging, but it's making us happy. Thank you.
Thank you very much, Dr. Agustin Kusumayati, University Secretary, Universitas Indonesia, Professor in the Faculty of Public Health, for your sharing about the MCH Handbook experience in Indonesia. At this point, again, we would like to flash our QR code to invite our participants to post their questions. Okay, so at the end of our presentation, all of our live presentations from our live presenters here, we will be giving 15 minutes. So we will entertain 3 questions from our face-to-face participants and another 3 questions from our online audience. Kindly state your name, designation, affiliation, and to whom you would address your inquiry. So please take this opportunity to scan the QR code and then type your questions. Or if you don't want to share your question via our QR code, you can ask them live later on. Okay, so again, we encourage you to, or you can write down your question so that later on our presenters will have time to answer them. Okay, so to continue with our discussion and sharing of the global experiences on maternal and child health and the MCH Handbook, may we hear from Professor Yasuhida Nakamura, Chairman of the International Committee on MCH Handbook, to present about the MCH Handbook in Japan.
Thank you. Yeah, it is my great pleasure to have an opportunity. Ladies and gentlemen, it is my great pleasure to have an opportunity to give my presentations. In this time, I would like to focus on the MCH Handbook in Japan. Next slide, please. Outline of the presentation, historical trends of maternal and child health in Japan. And the second is the MCH Handbook in Japan. Third is the MCH Handbook as no one will be left behind. Next, please. And Japan's experience as a developing country just before economic development. Japan was itself a developing country. And there was no high prevalence. When I was young, many children worked near their household, and there was a high prevalence of many kinds of infectious diseases, and including tuberculosis. And many children died before their first birthday. This is a reality in Japan. Next, please. And UN development goals. So before SDGs, you already know. So MDGs made a target to reduce child mortality rate by 2/3 and reduce maternal mortality ratio by 3/4 between 1990 to 2015. Next slide, please. This is a maternal mortality ratio in Japan. And maternal MMR so decreased so constantly, but so this blue line is MMR is dropped sharply from 184 in 1954, and now is only 3.4. But blue line is a declining rate, as the same as MDGs. Japan's MMR declines twice as fast as a MDG's target. Next, this is the infant mortality rate. Infant mortality rate also has shown a drastic and constant decrease from 96 in 1947 to 1.8 in 2022. But so this also blue line is the same, shows a blue line is a rate of decline targeted by MDGs, reduced by two-thirds in 25 years. And this means blue line shows that Japan's infant mortality rate also declines twice as fast as the MDG's target. Next. And I would like to show you the one good examples in very small village. And I would like to introduce Sawauchi village in Iwate prefectures, poor village with many disease and much snow. And its population was only 6,000. And Masao Fukuzawa, or head of village, hires 3 nurses here. Okay, next slide, please. And red bar is the infant mortality rate of Sawauchi village. And the blue solid line is the IMR of Japan. IMR of Japan decreased from 40 to 20 from 1956 to 1972. But so during this time, IMR in Sawauchi village was 0 in 1962 and 1967. Infant, next slide, please. Sorry, next, please. And IMR 0 made a big impact, not only in Japan, but also in the world. And 4 possible factors caused these miracles. One is a strong political leadership. Second is a mixture of medical care and prevention care, so-called both population and high-risk approach. Third is a public activity of the nurses and midwife in this village. And fourth is a active community active community commitment. And so these 4 factors made a miracle of the small village. Next. This is the infant mortality rate in Japan and the United States. We compare, and a joint Japanese and American research team in which I also participated conclude there are 5 possible explanations for Japan's low infant mortality rate. Japan's IMR is in 1950, IMR in Japan was about double that of the US. However, in 1964, this red line is Japan's infant mortality rate. This Japan's infant mortality rate is lower than that of United States. In that time, Japan was still poor countries, and the state of the economy cannot explain everything. And even though the economic situation is poor, but so we can enjoy health and well-being. Next slide, please. And so this is Japan's research, the results of the research, possible explanations for Japan's low infant mortality rate. One is a narrow socio-economic distribution. Second is a national health insurance. And third and fourth is very closely related to maternal and child health. Maternal and child health handbook. Number 4 is a population-based screening and health checkups. Next slide, please. And this is another thing that you know SDGs. But so in this time, I would like to say only neonatal mortality rate, NMR. This is less than 12 per 1,000 live births is a global target. Next slide, please. And this red line is a neonatal mortality rate in Japan. And neonatal mortality rate in Japan in 1967 was 9.9. That means it was less than the global SDGs target. When Japan reaches the global target of NMR 12, Japan has only the MCH handbook and the national health insurance system, and other things is health professionals and nurses work at the hospital only doing warm nutrition and infectious prevention and oxygen, very basic care. And we didn't have a mechanical ventilation, especially NICU, high technologies. And I think so neonatal mortality rates decreased in Japan before medical high technology development. Next slide, please. I would like to show you one midwife. And I make a historical review about the midwife and the public health nurses in Japan. And I would like to introduce also a life history of one midwife in remote village in Nagasaki. She experienced with atomic bomb at Nagasaki. After that, so she returned to her her island, and she attended about 200 births per year. The community appreciated and respected her activities, and she also respects the community. Such a mutual respect and appreciation between healthcare workers and the community is a key factors to reduce infant mortality rate and to promote maternal and child health in the communities. Next. This is the role of the midwife, of the practitioner in Japan. I emphasize ensuring the quality of life of the woman. They educate the grandmothers and fathers to build bridges between traditional customs and modern technologies. Next. And so this is a MCH handbook in Japan. First published for the first time in the world 1948. Next. Next, please. And this is the contents of the MCH handbook, as the same as other countries. Health record and information on pregnancy, delivery, newborn, and child health. But so Japan's ones is the basic concept is common throughout the Japan. And however, each municipality can edit by themselves and add specific local information. And so sometimes they change the color of the page or size of the page. And that's why so each municipality, local government decided to change these things. That's why, but so still they keep the common basic concept nationwide. So these are so two kinds of the factors is very good for the nationwide maternal and child health handbook. Next. And health examination also and the detection for the developmental problem. There are so many development health examination are conducted with relationship in maternal and child health handbook. Mass screening for metabolic disease, motor development, intellectual development, psychological issues, and dental health are checked and recorded in the MCH handbook. Next. And originally, MCH handbook in Japan is used until the 6 years old, but some municipality already started to extension to school age. Some municipalities have made it possible to utilize the MCH handbook even in school age. Next. This is the app MCH handbook. This is, for example, Himawari no Kai. And other private company also already started the digital MCH handbook series. The users can get official information on MCH from local government. Okay. Next. We would like to conduct the research on maternal and child health handbook by Ministry of Health, Labor and Welfare. I am a team leader of the research team. And this is Noriko Komatsu already reported 2022. And do you keep your own MCH handbook? And respondents is near 313 respondents. Average age is 34 years old. So we make a questionnaire to some parents who visit to child well-being clinic. And my parents keep my MCH handbook nearly 50%. I keep my own MCH handbook nearly 38%. This is a reality. Next. And do you think the MCH handbook belong to? Who do you think the MCH handbook belong to? Children's means 64%. And belong to mothers means 24%. Mothers think so. MCH handbook is their own handbook. Okay, next. And what will you do with the MCH handbook when your child is old enough to keep it? 57% respondents, they will give the MCH handbook to their children. But 34.5% said, I will continue to keep it. Yeah, so this is a reality of the MCH handbook in Japan. Okay, next. And I would like to move to No One Left Behind. And SDGs said, we pledge that no one will be left behind. But this is very famous word. But so I like next sentence, as a field worker. And we will endeavor to reach the farthest behind first. So this is in SDGs. I like this phrase. Okay, next, please. So, little baby handbook. Maybe tomorrow, Akemi Bando-san will explain much more. But so in this time, I would like to say, so this English version, Shizuoka Prefecture, you can download English version. And 68 pages English version you can download, which is very cute and supportive to families with little baby. And please you download once again LBH in Shizuoka Prefectures. Okay, next please. And so this is a maternal child health handbook for international families living in Japan. Today I bring so this is a Tagalog or Filipino version and a special version. So because there are so many Filipino mothers are living in Japan, they can communicate their conversation in Japan. They can communicate with health professionals. But so it is very difficult for them to read Japanese. And that's why so we make also such a special Tagalog version. And many Filipino mothers living in Japan enjoy to use this one. Yeah. And we already have also 10 languages. English, not only English, Chinese, Filipino, Indonesian, or Koreans. And by writing both in Japanese and other language, the handbook can be used by both non-Japanese patient and Japanese medical personnel. This is our idea. Next. I would like to show you another book. This is a twin book. Twin book is contain information on multiple pregnancy, childbirth, and child care. And I would like to show you these. And Plus Happy is Plus Happy gently helps the families of children with Down syndrome and other chromosomal induced disabilities. And we make also such many kinds of the handbook. But so this handbook is the only sub-book of the MCH handbook. MCH handbook is a Japanese version. And so, but so another special needs of the mothers and the children who have special needs would like to use these ones in as a sub-book. Okay, next, please. And so this is a Braille version of the MCH handbook. Yeah, and because so for visually impaired parents, this is published by the Japan Family Planning Association. But so, frankly speaking, this book is very, very heavy. Yeah. Okay. And then next, please. This is a special version. It's a pregnant and child-rearing mothers with intellectual disabilities. Because so many technical vocabularies of maternal and child health and medical terms are very difficult for the mothers with intellectual disability. And that's why so we make a so special guideline to how to understand so these contents for the mothers with intellectual individuals. This is one of the support book of the MCH handbook. Okay, next. Oh, this is a nearly final version. And towards further utilization of the maternal and child health handbook. And MCH handbook promotes a network among children and families and medical facilities and local government and national government under the combination of paper-based MCH handbook and digital record and digital information. And we would like to try to utilize MCH handbook to reach the farthest behind first. And the next. Okay, and finally, I would like to show you the British Museum. And the British Museum in 2008 said, Japan from prehistory to the present. In that time, British Museum said, Japan has successfully developed a thriving, modern, and high-tech society while celebrating many elements of its traditional culture. I would like to say same words to you. And each country will promote health and well-being for mothers, newborns, children, and families, while you celebrating many elements your own traditional culture. Thank you very much for your kind attention. Salamat po.
Thank you so much to you, Professor Yoshihide Nakamura. Again, Chairman from International Committee on MCH Handbook from Japan. So for the next sharing for global experiences, we have MCH Handbook for high-risk mothers in South America. So she's an associate professor from Department of Nursing, Faculty of Health Sciences, Asahi University. Let us all welcome Dr. Lourdes Herrera Cadillo.
Ladies and gentlemen, good afternoon. Thank you very much to the organizers of the Regional Conference on Maternal and Child Health, Calabarzon, and to the distinguished organizers of the International Committee on MCH Handbooks, the Chairman, President Dr. Nakamura, Dr. Calvin Reyes. Thank you very much for this invitation. I'm honored to be with you here today, especially because this is a chance to learn from all of you. And my presentation today, MCH Handbook for High-Risk Mothers in South America. I am a Peruvian midwife. I'm based in Japan right now. And I would like to make a presentation about, next slide please, about the development of some MCH handbooks in South America and Latin America, and the high-risk pregnancy and maternal mortality in my country, Peru, and the MCH handbook contents a special handbook for high-risk pregnant mothers. Next, please. In our experience in South America, and I would say Latin America because I want to include Mexico, have not been as fruitful as in other continents. Up to now, MCH handheld records have been implemented using top-down approaches by central governments. They have not grown from the grassroots. On the contrary, they have been implemented by the governments in most countries. The projects have had the experience, of course, from JICA and UNICEF and other international organizations. However, they have not taken and being as fruitful as you have seen the examples from Indonesia or from Thailand. Currently, we have 2 countries utilizing MCH handbooks. We have Argentina using MCH Handbook, Mother and Child Health Handbook, since 1983 as a national system. And they are implementing it with both private and also public institutions. The other example is from Ecuador. In Ecuador, UNICEF has implemented the MCH handbook. It started with a maternal handbook and a child handbook separately, but now they have been integrated together and are being used as an integral one whole maternal and child health handbook. So the contents are appropriate to the situation in the continent, the diseases that we have, infectious diseases and chronic situations, conditions that we have in our countries. And they are updated regularly in each region. We have the challenges that in many of these countries in Latin America, there is a reluctance to use an integrated MCH handbook. Most of the countries still prefer to have a separate child handbook and a mother handbook. It depends on each country on how to implement this handheld tools, but we cannot really, I could just speculate about the reasons why the situation in Latin America is showing that MCH handbook is difficult to implement. We do have some cultural issues. We have, like in other countries, we have several languages spoken and several cultures living together in a country, and this could be also one of the challenges, but I think one of the main challenges is stakeholder involvement. In most of the countries, since the programs are implemented by the governments, by the central governments, it is very difficult, if not impossible, to have the opinion or the input of the stakeholders, the users. They are not they are just provided the handbooks, and most of the time they don't have any opportunities to learn how to use them or why they should use them. Or maybe also about the improvement of this content. The next slide, please. So here is a summary of the handheld records, the home-based records in South America and also in Mexico. In Mexico, a JICA project, there was a JICA project between 1992 and 1998, and they had in one of the cities of Mexico, one of the regions, there was implementation of the maternal and child health handbook. However, it didn't progress. It has been replaced by other type of handheld records, one for the pregnant mother, one for the children. The next one, the Dominican Republic. I had the privilege to participate in the implementation of the Dominican Republic Maternal and Child Health Handbook, and we had it for several years. Unfortunately, governments change, and the situations in Latin America change very much due to government fluctuations and policies. Policies do not support the implementation of Maternal and Child Health Handbook in Dominican Republic, and we went from having one Maternal and Child Health Handbook to split it again into Mother Handbook and Child Handbook. So currently, we do have separate records. In the third, to the right, you see this is the experience in Chile, the very southern country in South America. They also have handheld records, but they are for the mother and for the children separately. Paraguay also had the support from JICA. JICA implemented a project in 1995, but after the project was implemented, the book went back again to be mother book and child book. Finally, the experience in Peru, we do have the handheld records. We even have some digital version of handheld records, but they are mainly just to register information. They do not provide education, and they do not provide spaces for mothers or for children to follow up. So we still are struggling. So you will see the difference with other countries. We are still struggling to implement a tool that combines information with education also, and with opportunities to be involved in your own care. The next slide, please. So in South America, these are the only two available maternal and child health handbooks, integral. They are both used, one in Argentina, and it's a national and provincial system. It's free of charge. It contains the mother and child health records. It's used until 19 years old, until the child is 19 years old. It has a legal background. It's supported by law, and mothers are trained to use this MCH handbook. Of course, it contains a lot of information, is updated. It contains a lot of metabolic disease screening, about infant obesity prevention information. It has father's participation page, infectious diseases, etc. And to the right, you will see the experience in Ecuador that has been implemented with the support of UNICEF. This experience with the UNICEF has started in 2016, and it's being extended to the whole country. Again, the whole country, the government has taken over this decision to implement the handbook, and we can see that one of the main challenges is that there is very or no participation, no involvement from the stakeholder, the user. The next slide, please. So now, before talking more about our project, our sub-book, I would like to refer about high-risk pregnancy and maternal mortality in Peru. In Peru, we have that maternal mortality ratios have been decreasing steadily. We had, until 2006, we had 119 deaths per 100,000 live births, but in 2023, according to last data of the Ministry of Health, we have been down to 69 per 100,000 live births. So it has been steadily, and the decrease has been steady, and it has also been significant. We had a peak during the COVID pandemic. Of course, I think every country had. But after that, we continue to decrease maternal mortality ratio. However, these numbers are still high. You would agree that these numbers are still not, we have a lot of space to improve. We have more room to improve here. We can see also that high-risk pregnancy factors change with the years. After 1990, we have an increase in C-sections. We have an increase in women who deliver babies after 35 years old, etc. However, our direct maternal mortality causes still continue to be hemorrhage, hypertension-related diseases. We have obstetric causes and abortion. We also have something that I would like to call your attention to. To the right, we have the characteristics of this death, the timing and the place of the death. Most of the death for mothers in my country will take place during the puerperium. So once the mother loses contact with the hospital, she goes home, she may not be back to the hospital after delivery, and then there is a larger possibility, there's a higher possibility that she will die. During pregnancy, also we have a high rate during pregnancy, and less during delivery. And when we talk about the place of death, around 70% of women die in a health facility, in a hospital or health center. But around 30% of women, 1/3 of women, will die at home or on the way to the hospital. So this is something that we have to take into account when we want to implement a tool like a maternal and child health handbook. So we know that we need to continue care, not only during, we do not just to care during pregnancy, before pregnancy, we have to continue caring for the mother to avoid this death. And also, we have to find out why are these people dying on the way to the hospital? Why are these mothers at home when they start having problems? Do they notice they have a problem? Why don't they go to the hospital? The sad thing is that most maternal death, and this is because of the population distribution in the middle of this, to the right, there's maternal death occurring mostly in Metro Lima, the capital city. We have a large population in Lima, and the suburban areas also show that most maternal deaths occur in Lima. So they do not occur in some faraway province. They will occur in the capital city where you have supposedly more access to health facilities. So this is another factor that we have for this high maternal mortality rate that we still have. Thank you. The next one, please. Our risk factors have changed. Maternal mortality ratios have gone down. Why do we need handheld records for high-risk mothers? Why do we need a special consideration, a special part of the handbook for high-risk mothers? We found that 70% of death occurred in high-risk pregnancies. So those mothers who were diagnosed as high-risk during pregnancy were had more chances to die than other mothers. 35% of pregnancies are high-risk pregnancies in Peru. Even though this concept, the definition of high-risk pregnancy may vary, but still we have a lot of high-risk pregnancies. We have also that the incidence of preterm labor in Peru is 20.3%, like almost 3 times over the maternal mortality rate in the preterm labor in the world. We have social factors like illiteracy, water services, electricity. So I cannot tell you enough about this. We will just say poverty. If you are poor, you don't have light, you don't have access to water, you don't have access to hospitals, etc. And we have delays in access to care. Can women recognize signs of warning during pregnancy? 60% almost can do it. 33% cannot. So do they go to the hospital? Do they look for care? 13% don't. They have difficulty to access health services. Yes, 40% of them have difficulties to access health services because of distance, transportation facilities, cultural issues, etc. So what do we have? 25% of deceased women had no prenatal care. 33% of them didn't know how to recognize signs. And even if they knew how to recognize the warning signs, they didn't look for care. The next one, please. So why we developed an MCH handbook, a sub-handbook for high-risk mothers? We already know the reasons. We have selected this hospital. The level 3 is a national hospital located in suburban Lima. The referral institution for 40 health centers, this is the number of beds. It's a large hospital, but it's still a general hospital. And the most of the patients coming to this hospital are high-risk mothers. The information and the handbook that we have is not enough. We think that we need to provide them with more information. Most of them admitted for hyperemesis, for urinary infections, hypertension. Recently, we have a lot of dengue fever in Peru, diabetes, hemorrhage, etc. The next one, please. So what do we want with this project? Why have we started this project? We started to inform, to educate, but we also had some criticism. Just giving information to people, just handing them information is not enough. You need continuity of care. So in the first phase, what will we do? During hospital administration to high-risk unit, we provide information. We provide the manual. We try to, what do? We try to improve the knowledge and also improve antenatal care attendance, improve recognition of warning signs during pregnancy and postpartum, and create a seeking care plan. In the second phase of this project, what we do after hospital discharge, we provide guidance and we provide guidelines to involve the mother and the families in the care of the high-risk pregnant mothers. We want to ensure continuity of antenatal care and be very clear with our message. Recognize an alarm, a warning sign, and come to the hospital. and make up your mind, simulate together with your healthcare provider, create a plan, what you will do in case you have a problem, how you will get to the hospital. So they work together and they follow up. And this is what we have been implementing in this general hospital. The next one, please. We are thinking on the third phase now, but just to take care of the mother when she gets home and has to do child rearing. So the contents for these high-risk mothers are about the high-risk pregnancy, factors associated with high-risk pregnancy, understanding the symptoms, recognizing the warning signs, beware of weight gain, and in the second phase, after discharge from the hospital, we support daily life and high-risk pregnancy after discharge, warning signs during the postpartum, how to act in case of these signs, and checking self-care points with your healthcare provider. The next one, please. So we use material provided by the Ministry of Health. We print them out because the Ministry of Health only provides us material to show the mothers, but we print them in an A4 page and we provide them, ask them to place them on the refrigerator, on some place that it's visible for you, and write down a phone number that you will need, etc. The next one, please. The next one, please. So our message is very clear. We insist, we write down, we highlight, come to the hospital immediately. Recognize the sign, come to the hospital immediately. Next one, please. We try to use material from other institutions. We try to maximize on something that has been already prepared at the time. And we try to provide mothers with the information and talk to them, follow up with them on the phone or next visitors. We are right now expecting to get the information, collecting the data from what we have been doing. We know that we need the evidence to support what we are doing, and we will do that in our next step. And thank you very much. That will be all for my presentation.
Thank you very much, Dr. Lourdes Herrera Cadillo, Associate Professor from the Department of Nursing, Faculty of Health Sciences, Asahi University, for presenting your regarding MCH Handbook for High-Risk Mothers in South America. At this point, we will proceed with our last presenter. Her presentation will be about strengthening implementation of maternal and child health handbooks across the globe. So to present this, may we call on the Senior Advisor on Health of the Japan International Cooperation Agency, or JICA. May we have Ms. Keiko Asaki.
Thank you very much. It's a very honor to me, for me to speak today with you. Today, I'd like to talk about two books. WHO Guidelines on Home-Based Records for Maternal, Newborn, and Child Health, and Implementation Guide by WHO, UNICEF, and JICA. And so that I can tell you what the efforts globally are done to promote the home-based record use for maternal and child and health, including MCH Handbook. Next, please. Next, please. This is the photo of the official side event at the WHO World Health Assembly in 2019. It's a side event held at the time, and it was initiated by the WHO member states, namely Indonesia, Afghanistan, Kenya, Laos PDR, Philippines, Myanmar, and others. They co-drafted the proposal, which was adopted through very high competition, and it became a reality. From Japan, JICA, as represented, as presented, as were other major partners like UNICEF and the Save the Children Fund. The WHO DG was holding the guidelines on his hand. The guidelines was launched as the first comprehensive guidelines for home-based records for maternal, newborn, and child health. Why have the guidelines have been developed, and what have these countries raised the voices to them? Next, please. A home-based record is a written record of an individual's health and kept at home and mobile. It contains details of health and development status, care received, and vaccination administered. There are various forms, as you know, some for pregnancy, some for childhood vaccination, or integrated format like MCH Handbook. At least 163 countries have some kinds of home-based records for mother and child, but they are not always fully utilized. Next, please. The continuum care, the care during the pregnancy, childbirth, and childhood. Those services are expected to be provided at home in the primary healthcare facilities and hospitals. There's such a different layer of the services. The home-based record can be seen as a people-centered tool that enables the mother and child of our question to have their own data at hand. Many countries have become interested in the example of Japan and other countries, which has MCH Handbook used in their health systems and for a long time enough, especially as a tool that can link care at the time of the life. Next, please. In practice, many countries have immunization cards already, and often other cards as well. So when introducing an MCH handbook to a country, those existing cards need to be integrated. Many countries, to be honest, have struggled to coordinate such integration. Of the many home-based records, the most widespread was immunization record, as you may acknowledge that. So, to be honest, as a promoter of MCH Handbook, we assume that immunization program would favor cards that could be produced independently of the program. But after having the series of discussions, so we found that immunization program also had intention to work with other programs like MCH so that they can improve the immunization coverage further. So above all, immunization program wanted to promote the home-based record as they already acknowledged the value of the data on the home-based records is it would be more precise than maternal recall or the memory. So in order to promote the effective use of home-based records, the first step was to reaffirm the value of the home-based records. Therefore, WHO reviewed the evidence on all formats of home-based records and developed the guidelines recommending the use of home-based records for maternal, newborn, and child health. Guidelines jointly developed by 3 WHO departments. You may see the name: the Department for Maternal and Child Health, Department for Immunization, and Department for Reproductive Health. This multi-departmental development has encouraged programs in country to promote use of the home-based records across vertical programs. So it not only belongs to the single program, but 4 programs who are working for MNCH. Next, please. So 2 recommendations are written. The first one is to encourage the use of home-based records for maternal, newborn, and child health, namely to improve care-seeking behavior, male involvement and support in the household, in maternal and child home care practices, infant-child feeding, and communication between health workers and women parents and caregivers. The bracket later tells us that it's with the low certainty evidence. So it means that we need more data on each outcomes if we would like to have higher certainty level of the evidence. The second point is homeworks for us. It states that there is a lack of information on which forms are better than others. It means the mother's MCH handbook is better than others. We don't have enough information, but home-based record itself has a value. And that it is important to implement them effectively because the outcomes we can get from the implementation of home-based records, the quality of implementation matters. Next, please. Countries often face common implementation problems that hinder effective implementation of home-based records to obtain expected outcomes. There are frequent stockouts, poor quality of home-based records, inadequate use by health workers, poor retention by women. The content and the design may not meet the needs of users. Next, please. For example, information gathered by immunization programs shows that some countries have reported stockouts of vaccination forms, including MCH Handbook, if the country has the MCH Handbook, and that some countries have had stockouts for a long period of time, as indicated by darker colors. Next, please. MCH Handbook promoters may need to listen more from immunization programs. They have conducted several sets of assessment for the missed opportunity vaccination. The one case is from Kenya. And the 70% of health workers agree that vaccination status should be assessed at every health context, including child wellness visit or the sick care. However, around 30% considered only nurses have responsibilities of immunization tracking. That's the reality. To reduce missed opportunities for vaccines, immunization program suggested that all health workers at every health encounter ask clients to show your MCH handbook. Not only making available, but also we need to provide MCH handbook to all children and counsel the caregivers. All sections of the record are legibly completed. Otherwise, ensuring continuum care is difficult. So they also suggested us the importance of the periodical review and the critical assessment of the contents of the home-based records and the design, where there it's still fit for the needs of the end users. Next, please. So, a guide to strengthen the implementation of the home-based record has developed jointly by WHO, UNICEF, and JICA to support decision-making and efforts to strengthen home-based record implementation through processes for planning, design, implementation, and monitoring, and address challenges related to home-based record implementation. Intended users are program managers and the stakeholders in each country and region. Next, please. The guide was created based on tools used in different countries and feedbacks from countries. JICA shared more than 100 tools as a fruit of collaboration with partner countries, introduced key informants of the respective countries, and repeatedly commented on the drafts, which now had become the shape, the commentary. Next one. This implementation guide consists of 7 chapters, and it's structured in such a way that the readers can select the necessary sections when you need. So for example, you are now planning to revise or you are planning to strengthen the operation. Next, please. And also, we propose to make home-based records from the user's perspectives, namely women, parents, and caregivers, of course, and health workers, of course, and program managers. Next, please. And 8 success factors were identified through the framework analysis, in which they helped to ensure the efforts to strengthen the home-based record achieve their intended impacts. So they are, first, high-level support exists or not. And the second, the coordination mechanism exists to involve the variety of the stakeholders. And the third is the contents is fitting for the needs or the allow according to the updated policies. The fourth is printing and the distribution, such as logistic mechanisms. And the fifth is financing and funding. And the sixth are the health workers valued on that. 7, and mothers, women are valuing on that. And last one is where there we have the monitoring of its implementation. Next, please. As I told you, whichever you can start to read and you take, the color that help you to indicate which part you can read. Green color, it will provide you the key themes with country examples. And the pink color provides us the templates along with the necessary activities and the work to support decisions. Next, please. This is one example of the template to assess performance of operational support processes. And you can see that each operational support processes, up to 8, could be set, assess performance level, and what is the enabler and barrier, and who has the responsibility of this one, and what we can change. This simple format can help discuss among the stakeholders. Next, please. Actually, the Burundi has already tried it out, and they said we are excited because this template allows us to discuss essential implementation elements from different departments and programs. I hope that the Burundi panelists will tell us the fruits of discussion. Next, please. Yes, another template is about to help the reviewing the contents. Because some countries has 3 to 5 or 10 years per annually, so they revise the contents. At the time, the contents would like to just keep it, or they need to modify it, or add something extra information, or remove it. For example, the first one is about the message for the exclusive breastfeeding promotion. So information support to strengthen it, that's why they would like to modify the contents, and they would like to monitor whether the revised content is used or not. So the monitoring is set, and also it's not only just the add or the keep, but removal is one option, so that we can keep the home-based record contents is essential. Next one, please. The sharing is from based on the international knowledge sharing. So this template may make this kind of the knowledge sharing programs be more fruitful. The Indonesian government in JICA held the session by inviting 8 more countries like the Kenya, Madagascar, Thailand, Laos, Timor-Leste, Cambodia, Vietnam, Tajikistan. So including Indonesia, out of them, 8 countries has already MCH Handbook in nationwide. And then they said the use of the template enabled them to identify where we are weak and where we are strong, and identify the issues that to be prioritized and the order of a priority. So they are expected to fill in the analysis at their country, and on the first day they present the result so that they can understand in the same line and discuss more deeper and to identify more practical action plans. I think the Tajikistan delegates, when you started from your country, you already do this kind of the exercise. That's why you have a clear picture what you learn from this gathering. So it means these templates may be used for facilitate the regional learnings also. So because the Philippines has many good practices in the different contexts, and across the context, maybe you can learn deeper your learnings by using these templates, I hope. Next, please. So after the guidelines, so we have more guidelines from the WHO, including antenatal care, postnatal care, preterm or low birth weight infant care, self-care, and child care. For the ECD, nurturing care. So the many guidelines are now indicating to use the home-based record. So this is the environment now. Next, please, the last one. So I hope we have passed the long way to come today. And today's the first regional meeting and the 14th international gathering will help promote the step ahead for the effective use of home-based records and the maternal and child health handbook for the benefit of women's health and well-being. Thank you very much for your kind attention. Salamat po.
Thank you very much, Ms. Keiko Osaki, the Senior Advisor on Health from the Japan International Cooperation Agency, or JICA, for discussing strengthening implementation of maternal and child health handbooks across the globe. At this point, we will have a 5-minute health break. And also, let's take this opportunity to express our sincerest gratitude to our generous partners.
So we have Japan International Cooperation Agency,
We have Friends of WHO Japan,
HANS Health and Development Service,
Canison Company Limited,
COA Company Limited,
and Himawari Nokai. Okay, we have a bit of change with the flow of our program. So instead of proceeding with the question and answer or plenary, we will continue with the online presentation, because what we have seen are the face-to-face or the live presenters. But after our health break, we will move on with
Sharing of global
experiences on maternal and child health and the MCH Handbook. But this time, it will be our online presenters who will be joining us. And then after that, we will have the final plenary and question and answer. So we already have some questions. We already received some questions here. Most of them are very interesting, no? Very interesting questions towards our presenters. So may we ask our technical group to please present the QR code again for some of you who would like to raise questions later on. So please feel free to post your questions. And our presenters, both online and face-to-face presenters, will be answering them later on. So here, we already have our QR code. So please take the time to scan the QR code, type your questions, and later on, again, we will have the plenary after the presentation of the online presenters.
So again, we will be giving them a 5-minute health break. Thank you so much.
Thank you. Okay, so I think we're good to continue with our presentation. So as we said earlier, this time we will be joined by our online presenters. So they will be discussing, we will continue with the discussion of the sharing of global experiences on maternal and child health and MCH Handbook. So this is part two, and again, this will be done by our online presenters. So I hope, by the way, you have given your questions. No, so we have seen some questions. As I've said, they are very interesting, and I hope, and I'm sure, our presenters earlier will be having a good time in answering them. Okay, so let's start with the presentation from this is from Canada and the United States of America. This is entitled What We Achieved Post 13th MCH Handbook Conference Lessons, Learning and Experiences from Canada and the United States of America. So we will have the Associate Professor an SBS Program Coordinator from the Division of Social and Behavioral Sciences, School of Public Health from the University of Memphis. So let's all welcome online Dr. Shafi Buyan.
Beginning first regional conference on MCH Handbook and 14th International Conference on MCH Handbook in Manila, jointly organized by International Committee on MCH Handbook and University of Philippines, Manila. Today, I would like to share our experiences. It's a global experience of Maternal Child Handbook in the past 13th International Conference on Handbook, lesson learned, experience from Canada and the USA. I'm humbled to present along with my colleagues, my internationally trained experts, research team, academia, postgraduate students, and health department colleagues. Let's get started. We know that SDG number 3, goal number 3, emphasize good health and well-being. Achieving that multifaceted approach, we need innovation, we need collaboration, sustainable development efforts. MCH Handbook emerged as a crucial resource to ensure continuum of care so that no one left behind. MCH care is fragmented. Recently, Canadian Medical Association Journal emphasized on that. And so that we need to fix it, and we need an urgent and reform in the health system. And last 2022 fall at EFT, we share our maternal child activities in the world. I would like to join me, Dr. Agafaya, who was one of the key person, Maternal Child Handbook Conference, 13th conference in Toronto, to share our success and our achievements in the conference. I'm now opening the slides. Just bear with me. Can you see that? Yeah. Let's get started. Gaffer, go ahead.
As Dr. Shafi mentioned, we were privileged to host 13th Maternal and Child Health Handbook International Conference in Toronto that brought together more than 705 participants from around 61 countries and territories around the globe. So we have also special guests from global organizations such as WHO, UNICEF, UNFPA, and JICA, as well as presenters from more than 15 countries around the world. And the formation of conference declaration was a collaborative effort, pulling together all the expertise and the insights that was published in our preceding books and disseminated among all of our participants. And you can see on the screen some highlights from Toronto Declaration. So MCH Handbook is considered as a global standard self-care tool that provided holistic care to maternal and to mother and child. It also, as it could be tailored to the needs of particular population, and that is why it embraces ADI, equity, diversity, and inclusion principles to healthcare. To ensure sustainability of MCH Handbook, it should be ensured multi-sectorial, multi-level approach with social mobilization and political commitment as well. And the way of the future development is digitalization of MCH Handbook. We published the short version, the highlights of our conference in one of the international public health journal. And our team also published another paper synthesizing the MCH Handbook impact on health promotion, including breastfeeding, immunization, improving health literacy to ensure safe delivery and healthy baby. Thank you for your attention.
Thank you. So you could say we have more than 700 people from 61 countries join, and we share our informations together with our colleagues around the world who is promoting maternal child health and healthcare system. So after the conference also, we don't want to limit only handbook in academia or the conference, we want to go to the field. Now let's listen how we started in our field study in rural Bangladesh, in northern and west eastern Bangladesh. So I'd like to ask Dr. Mustari to start.
Thank you, Dr. Shafi. I am excited to share some pivotal updates from the recent 30th International Conference on Maternal and Child Health Handbook. Our team has been tirelessly working on the third edition of these crucial resources. The MCH Handbook contains information on antenatal care, breastfeeding, immunization, nutrition, postnatal care, family planning, and other health promotional messages essential for continuing a healthy and safe pregnancy, delivery, and healthier childhood of the baby. Our focus has been on ensuring that the handbook is not only informative but also culturally appropriate for the diverse population we serve in Bangladesh. We have developed 3 distinct versions of MCA's handbook tailored specifically for the communities in the northern region of Rangpur and Jaipurhat, as well as for those in the southern region of the country, Bandarban and Khagrachari. The customization is crucial as it allows us to address the unique needs and the cultural nuances of each area effectively. Moving on to our strategic objectives, we have laid out a clear path in 4 phases to enhance the reach and impact of the MCA's handbook. In phase 1, at the policy level, we introduced the concept of zero home deliveries to ensure safer birth environments. Phase 2 focuses on sensitization about safe institutional delivery, ensuring that healthcare providers are 24/7 available. In phase 3, we emphasize community engagement, which is fundamental in gaining trust and ensuring the implementation of our strategies. Finally, phase 4 is about the establishment of a web-based service to increase the accessibility and ease of use of the MCA's handbook. However, we have encountered several challenges, including ethnic diversity, varying traditions and religious beliefs, language barrier, hard to reach areas, and gaps in literacy and decision making. By creating different versions of the handbook tailored to each area's specific context, we aim to overcome these challenges. Our goal is to ensure that every individual, regardless of their background, has access to the vital pregnancy information needed to make informed health decisions for themselves and their families. Now I invite my colleague Dr. Shanjida to share our intervention survey pre-test overview, which is ongoing.
Thank you, Mushtari Mimi. In our pre-test, we reached out to 498 mothers across three vital regions, Rangpur, Panch Bibi, and Bandarban, to understand where we stand and where we need to focus our efforts regarding maternal and child health knowledge across diverse communities. Two of these sites are non-indigenous and one includes an indigenous population. In Rangpur, our findings paint a picture of urgent need. Nearly 80% of mothers are unaware of the critical danger signs of pregnancy. Over three quarters lack basic knowledge about tetanus vaccination. A staggering 89% do not recognize neonatal danger signs. Child vaccination schedules are a mystery to 73%. 65% are unclear about safe birth control methods after delivery. Mounts BB shows different challenges and needs. Danger signs of pregnancy are unknown to 47%, and alarming 91.2% are unaware of the importance of the tetanus toxoid vaccine. 42% miss the neonatal danger signs, and child vaccination schedules are unknown to more than 90% of the mothers. While the level of education of mothers in the Bandarban region includes primary education, 37.31%, and secondary education, 44.28%, the Rangpur region has 100% on the primary education. Our aim is, armed with knowledge, each mother can become a guardian of health. We started with a protest, and after implementing our handbook, we will reassess knowledge to quantify our impact. With every handbook distributed, we anticipate a rise in understanding, a decrease in preventable complications, and empowered mothers who lead their families to healthier future. Thank you. Now I give the stage to Dr. Shafi.
Thank you, Mustari and Ms. Sanjita. Actually, I'm so thrilled that Mustari mentioned that MCH Handbook accessibility and also MCH Handbook actually one of the two-way communication tool which contain tailored information to guide mothers and their family through journey of the pregnancy, childbirth, and child rearing, including family planning and other primary care issues. So I'm glad that all the team member is work hard to make this multi-center projects which is ongoing. I hope in future we will update. But I would like to bring here Dr. Ong Lu, who is the Deputy Director of Family Planning in Bandarban, where we did the indigenous study. And Dr. Lung, you can have a short brief. How is your impression when we started with you? Are you there?
Yes. Okay.
Dr.
Thank
Ong?
you for your yes.
Just one minute, your reflection, how we did, and its status as of now.
Yeah, thank you for your kindness to scope me to deliberate overall impression on MCH Handbook globally and locally in Bangladesh. And well, thanks for Dr. Shanjida and Mustari. They are good presentation regarding how to introduce the MCH Handbook in Bangladesh. Especially, I remember when we are introduced in Bandarban, Mustari and his team under your leadership, they do a lot. Because this project is new into the hill tracks in Bandarban. But the impression is, come out from the pre-test regarding the MCH and handbook introduced, only 40% women are literate in indigenous population. So we can do a lot of scope how to create their knowledge, perception, and attitudes regarding MCH handbook utilization. If we can do the properly, likely the maternal death will reduce and other elements. I know in the MCH handbook, the pre-test questionnaire is including the 42 compartment here too. So we need to now in post data to how to improve in CST likely in Bandarban. That name is Ali Kodamu Upazila because we start on MCH handbook in 2022. So time is last on right now in 2024. So we need to compare what is the change regarding the maternal compartment in CST women. Lastly, in our data in MIS, there is a lot of change regarding the institution delivery. Now, right now, I think this month, the 46% are institution delivery in our pilot area. In the baseline, we before we start up, there is only 17% institution delivery in indigenous women. So a lot of change. It is a good practice. I think it will be replicated in through globally. If we can find a change, we make a difference for maternal child health. Okay, thank you for scope me.
Thank you for your cooperation, and we hopefully moving forward to expand and scale up to ensure the zero delivery in Bandarban and around the world where we started the handbook. So let's move from Toronto to Bangladesh to now Memphis, where I am thrilled to work with the brilliant researcher and the colleagues where we want to make sure MCH matters and how we can empower families in Memphis, Tennessee. And you could see there is a clear statistics we can figure it out in United States out of many states that you can see United States, Tennessee, and the Shelby County we are going to talk. The maternal mortality rate is almost four times higher than the country average or national average, 3.5 times higher. So that's clearly a picture that we need to address something to change the scenario. Black, African American, Black or African American, Hispanic or Asian, and white, all the group of mothers needs some extra care, some basic services. And I think MCH Handbook Nature gives us that opportunity to give this information so that people can use it. I would like to ask Shelley to jump in, to join me to give her inputs why it is important to be in Memphis Maternal Handbook.
So just hearing about Bangladesh and how successful everything has been there as far as the rollout of the handbook so far, it is really exciting to think about the future for Memphis. These statistics show that we have such a great need in America, really. I mean, maternal mortality should be so much lower, but especially in Shelby County. So this is the perfect place to start with a handbook. And we know that the health of mothers and babies starts before the babies are even born. So we really just want to spread this information in a way that is accessible to all and considerate of all of our population and their needs. So we are really excited to be working with Dr. Shafi to hopefully spread this handbook soon.
Thank you. As you know, I tried to summarize that MCH Handbook is the goal to produce is we have a social and racial disparities, not only in the United States, many places in the world is not different. So we need to address those things. And also we would like to serve as a culturally respectful services. And how we can do that? There is no tool existing available in Memphis or elsewhere in the world. To empower women, we need to provide those tools to the women and their family so they can use it and then improve the health status. And this is also employ the innovative technology we can use to best practices around the world. When I show this handbook in my class, Shelley and Rachel and other colleagues, they're so excited to do that. And I'm so thrilled that Rachel also here to share her thoughts, why it's important and what is her feelings to work with this. And as you can see easily when I demonstrate this thing in the class, and we really work together to map out what should be the content in handbook. And then clearly all these 12 people emphasize the time 14 weeks to develop the model or structure, what kind of content we're going to do. This is one of the examples. So I know many countries and many states, they have a different project, collaborative many way, but there is not handbook there. So that's why our team is very much interested to collaboratively to develop handbook. And they work very, very tirelessly. And I'd like to invite Rachel to come and give your impression. How do you feel to working with this project together?
I think it is absolutely essential. Memphis, as the previous slide showed, there is a lot of disparities found in Memphis. And I think it's essential to incorporate the cultural and socioeconomical and any racial differences that may be found in Memphis to provide the best information in the Maternal and Child Handbook.
Right. So the students are very excited. Researcher in the health department also get excited, get involved, and we would like to create the new knowledge, a new handbook for Memphis version. And we have a plan now. Now we just need to move ahead, how to implement those, develop those things, how to implement this, how we make a measure so that we can see the success or is impactful, serve the maternal child health system in Memphis in Shelby County. So we are not limit only in the classroom. We also would like to go to the community and learn from them. That's what we got to get together and we develop something. One of my PhD students also got interested to do that, and she just did her comprehensive exam for PhD based on the effectiveness of handbook on breastfeeding. So that is very impressive. So many things has been done. The 10 paper from 7 countries she explored, and she would like to mention how impactful it is to impress the mother and the family to breastfeed, exclusive breastfeeding. So that's one of the current role. We also have a not limit on the United States. We also have a moving to Thailand. Let's listen from Tanjida. Now she is doing an MCH Handbook idea in the urban slum through her academic study in her dear PhD. Go ahead. Are you there?
Thank you. Thank you, Dr. Shafi. So I'm Tamjida. So I am a medical doctor and a public health personnel, and I'm pursuing my PhD in Mahidol University. So I have decided to really work with the MCH Handbook and work in the urban slums, because I had been working with urban slums in Bangladesh in development sectors. So the title, I would say that effective, the previous slide, the effective of prenatal health education intervention to improve maternal and child health care utilization in urban slums of Bangladesh. So mainly, I would like to give an interventions to the community for the pregnant mothers with handling over the MCH handbook. Along with it, for the reinforcement, there will be in the intervention package, there will be offline prenatal class sessions. And along with it, to the other group that the mothers will be given, whoever has the smartphones, the information, what will be in the handbook for the reinforcement, it should be also given to the group. So there will be a WhatsApp group or the whatever platform will be available there. So because now smartphones everyone is using, and it has increased, and 48% of the people in Bangladesh are using smartphones. So this way they will be empowered, and then main outcome would be that they utilize the service for safe delivery at the institution, and also postnatal care that is still scarce. People are going for antenatal care, but still now postnatal care is still scarce. So that would be the beginning, and let's see, let's hope for the best. Thank you.
Yeah. So, and we know that Japan and other country handbook is using is a antenatal, postnatal, mother class, father class, and so on. And we'd like to emphasize on that. So our time is limit. So I would like to acknowledge our future directions, how we move forward. And you know that advocacy is the key, and our job as academia, train to create the capacity of the young professionals like my team, and also develop the training and management things, and also build the capacity of the system, so that in future digital version can add in, and also scholarly work can be disseminated for the best practices. So I think MCH Handbook to me is not only a toolkit or booklet, it's a beacon of hope. It empowers families, strengthens services system, so that in long term, it reduces maternal child mortality and foster a healthier world. Therefore, one thing is very important is a collaboration between government, non-government, academia, healthcare providers, and to vitalize this health book handbook impacts. Therefore, I'm very much optimistic and looking forward to the future scholarly work, what we are doing and what we should be doing. And this idea need to be integrated to a digital technology so that utilizing the potentials of e-health and health should be the bridge gap of the healthcare system, especially maternal child health, to empower women and their families to lead a healthier world. Again, I would like to thank my team to join me to work this novel things for the betterment of health and mother and child health in many countries. So I would like to acknowledge all of your contribution, and I'm looking forward learning together because together we are stronger and we should be always moving forward. Thank you all for now. Hello, everyone.
So again, that's the video from Dr. Shafi, Associate Buwian, Associate Professor, SBS Program Coordinator. So that is what we achieve post 13 MCH Handbook Conference, lessons, learning, and experiences from Canada and the USA. For the next video, we will be having progress of the nationwide expansion of the Maternal and Child Health Handbook of the Ministry of Health in Angola. So we have Toru Sadamori, JICA's Maternal and Child Health Project, specialist in Angola, and technical advisor of TA Networking Corporation.
I will talk about progress of the nationwide expansion of Maternal and Child Health Handbook in Angola. Dr. Keita of Angola Ministry of Health was supposed to give the presentation today, but due to work schedule, I will be taking on behalf of him. My name is Toru Sadamori. I am JAC expert and have been engaging with the project in Angola more than 10 years. MINSA, Angola's Ministry of Health, is implementing projects in the area of maternal and child health with support from JICA. One of the tools for those projects is the Maternal and Child Health Handbook. The MCH Handbook is fundamental tool for monitoring and evaluating pregnancy, childbirth, growth, and child development from conception to school age. MCH Handbook was piloted in 2014 as a part of the Health Improvement Project of Ministry of Health and JICA. Between 2017 and 2022, MINSA, with support from JICA, implemented PROMESE project to improve mother and child health through the implementation of the Maternal and Child Health Handbook in 3 model provinces to achieve integrated maternal and child care. To produce the Maternal and Child Health Handbook, the Ministry of Health combined 3 tools into one: a tool for pregnant women, a tool for children, such as vaccination card and growth monitoring chart, and health educational materials. Progress toward national expansion. MINSA and JICA developed a national expansion strategy based on the experience in the 3 model provinces and the result of the impact evaluation. The expansion strategy was endorsed by the MCH Handbook Committee and approved by MINSA and disseminated to 18 provincial health departments at the advocacy meeting in 2022. And the MINSA is leading the expansion of MCH handbooks throughout the country now. In 2017, MCH handbook was implemented in 3 provinces. By 2023, it was implemented in 13 provinces. and by 2025, it will be expanded throughout Angola. One of the key factors in the successful dissemination of MCH Handbook was cooperation with development partners and private entities. As you can see in the table, there was support from many development partners and the private entity. Printing enough MCH Handbook for expansion could not have been accomplished by the Ministry of Health alone or by support from JICA alone. I'd like to talk about comments and observed changes from users and service providers. From service providers, the MCH Handbook has changed the mindset of health workers and the community. Health centers also became more proactive in caring for mothers and children with special needs. And from users, the Maternal and Child Health Handbook is beautiful, which has led the pregnant women who previously didn't attend antenatal care coming to the health centers. Pregnant women's partners also began to accompany them to antenatal care. And MCH Handbook's effect, maternal and child health service utilization increased in health facilities in the project model provinces. As mentioned so far, the implementation of MCH Handbook has progressed successfully and various improvements have been achieved. However, challenges still remain. The most significant obstacle to continuum of care is the low rate of institutional deliveries. For this reason, the Angolan Ministry of Health and JICA have launched a new project mainly to improve the quality of childbirth. This is summary description of PROSMATCH new project. Target area is 6 municipalities in 2 provinces, and the period of cooperation is starting from September 2023, and the period is total 4 years. The MCH Handbook will also play a very important role in the new project. One is to improve health education in antenatal care through the use of MCH Handbook. The other is to use the MCH Handbook as a monitoring tool to implement quality care in order to increase mothers' satisfaction with health service. By checking the MCH Handbook during supervision, we confirm that the necessary services are being provided. The MCH Handbook also plays an important role in enhancing the health education provided to mothers before they are discharged from the health facility after the birth of their child. By investing in primary health care, the Angolan government is investing in the future of its population. This dedication reflects the vision for a healthy nation where all people can reach their full potential. We would like to express our deepest thanks to all the people and organizations that have worked so hard to promote MCH Handbook. Muito obrigado. Thank you. Salamat po.
So we will now proceed with the presentation of Dr. Oscar Tihabos. general direction of care provision, traditional and modern medicine, nutrition and facilities, accreditation, Burundi. The presentation is entitled The Use of Maternal and Child Health Handbook in Burundi. What is the way forward? So ladies and gentlemen, may we have Dr. Oscar Tihabosi.
Good evening, everyone. Good evening. I'm very deepest to stand and to present my situation in Burundi. As I start, let me tell you that improving the maternal and the child health is one of the priorities of the government of Burundi that plays the key role in the sector policies and the strategies of the Ministry of Public Health. Many initiatives and approach has been taken to improve the maternal and the child health. One of the strategies has been to improve the health information system through the implementation of the maternal and the child health handbook, the role of which is well known to the various stakeholders in the provision of quality health care and the services to the mothers and the children. As you can see there, Burundi is the smallest in the East African community near the Tanzania. If you know Tanzania, Burundi is near the Tanzania country. How about the maternal and child handbook in Burundi? Well before 2012, aware of problems that were being felt with the mother and the child, record there were discussions on the issues between the various stakeholders. And you can see before 2013, there was a whole range of notebooks in the public, such in public and the private sector. Each structure managed to or tried to imagine what format of notebook to use according to his convenience. But in October 2013, there was a pretest study to the introduction of maternal and child handbook concerning 25 health facilities. And there has been an elaboration with a memorandum of on December 2013. There has been a pilot launch phases on 25 facilities in 2 provinces. And in 2014, there has been a posted study of maternal child and the handbook effectiveness. The results were very promising. And in 2015, there has been a national rollout that has been took place in 2015. With the support of the development departments mentioned above, then you can see government, Gavi, UNICEF, JICA, USAID, which is still the big name in the game. And I take this occasion to express my gratitude to JICA, who is always supporting us to implement the maternal and child health care. the slide, the following slide. Now in the Burundi, you can see the service package in our maternal child and the handbook. On the national, there are many programs which are involved to use the maternal and the child handbook, in which we can find delivery, family planning, immunization, nutrition program, malaria, and so on. All programs are already involved to use that handbook, the maternal and the child handbook. The following. The following, please. Which are the strategies that taken to make sure that every pregnant women receive the maternal and the child health handbook? On my left, you can see that there are some policy decisions which are already viability. We have set up the policy decision after there is decentralization of service in terms of geographic access, ensure that all communities are involved, and after there are acquisition of the quality indicators as part of the PBF. PBF is such as an incentive, means that the approach encourages and improves good practices in the use of the maternal and child health handbook. And the following is to tell you the strategies taken to ensure that the effectiveness of the use of the following. The strategy taken to ensure that all women and health staff are aware to use the maternal and the child health facilities. That picture is the decree which have been signed to implement the maternal and the child health handbook in Burundi. It is a decree signed, the joint decree between the Ministry of Health and the Ministry in charge of Affairs Home. I told you about the verification of health system performance. In that approach, we are going to assess, for example, if handbook are available in the facilities and if it is very, very fearful. The following. There are strategies taken to ensure the effectiveness or continuous use by the women and the health staff. We ensure that there is regular integrated supervision during client care of service provider use to ensure that if the information we need is available at any time. Regular PBF assessment. There are some indicators purchased. We are going to verify on the field on the notebook for the mothers who came to visit the health facilities. And after, through the medical visit, there are obligations to take with the notebook when there is a need of care mother and child. Free care by presentation of the mother ID, for example, and the birth certificate issued by the server status. the following again. Which are what are the operational challenges in Burundi? Now we are facing two recurrent national stock out of maternal child and maternal child and the maternal child the health and the handbook. There is improper feeding of the maternal child and the health book by the healthcare provider. Most of healthcare providers and the community health workers are not aware of the importance of the educational message to contain the MCH handbook. There is still insufficient information of the population on the importance of the MCH handbook. There is no use of MCH handbook in private health facilities. There is a big challenge. A part of the population, service registration personnel, do not know the importance of MCH handbook to register birth. Which are the operational responses? To support addressing the operational challenges, at a level Minister of Health staff members was assigned to participate in workshop organized by JICA in Tokyo for the improvement of maternal health through the effective use of MCH handbook, as Mrs. Osaki told you. We have set up a national task force for the MCH handbook implementation as part of the action plan from the training workshop. After with the support from a Japanese expert, the task force organized a workshop for the situation analysis, applying the recent MCH handbook implementation guide, which are shown by Mrs. Osaka and developed by WHO, UNICEF, and JICA. And the following, there are a picture which shows us what is already done in Burundi to facing the operational challenges. The last I don't know, it is very, the picture is not very good or very smart, but you can see all steps which are already done to operational response. There is a process how to mobilize the budget and the financing, how to print, how to fit to the distribution and the stock management, the capacity building and the support supervision, coordination between health programs. Another challenge is the coordination. Now in Burundi, each program go through his plan without considering other programs. Now, I can show you the way forward from the task force for workshop. What we have to support operation process, the actions and must be to undertake, and the level of achievement. For budget and the financing, I'm sorry, we are faced to advocate to allocate a budget line for MSG handbook to raise domestic funds and to consider private sector and the community, integrate within programs manual budget planning. For coordination between health program, we have to organize intersector meetings to advocate at the highest level to discuss the issues in relation to MCH Handbook, to discuss the issues in the high meeting, what we call in the group Partners for Health and Development Framework meeting. Now, we can see now even if we are in the implementation of the MCH handbook, there are so many challenges we must face too. The first is coordination. And about that, we are planning stage through the task force to be institutionalized and the Ministry of Health. And I think I am at the end of my presentation. Thank you very much for your attention.
So thank you very much, Dr. Oscar Tihabose. The General Direction of Care Provision, Traditional and Modern Medicine, Nutrition and Facilities Accreditation in Burundi for your presentation entitled The Use of Maternal and Child Health Handbook in Burundi. What is the way forward? So this time we will move to Gabon. Okay, so we will have two presenters. First is the expert in maternal and child health of Project for Improvement, the continuum of care for mothers and children through effective use of the MCH Handbook in Gabon. So this is by Junko Watanabe, and joining is Miss Aline Sylvie Dicambi Maganga, midwife from the Ministry of Health of Gabon, National Department of Mother and Child Health, for the presentation entitled Development of MCH Handbook in Gabon.
Hello, I am Aline Sylvie Dicambi Maranga, midwife, Ministry of Health of Gabon, National Department of Mother and Child Health.
Nice to meet you. I'm Junko Watanabe, expert in maternal and child health of Project for Improving the Continuum of Care for Mothers and Children through effective use of MCH Handbook in Gabon.
Hello, my name is Rosalie. I'm going to make the presentation of this conference in English. Thank you.
Hello. Okay, as you can see on the map, Gabon is a Central African country with about 2.4 million inhabitants, and we are speaking from Libreville, the capital. So improving maternal and child health in Gabon is a major concern for the country's authorities, and the fight against maternal, neonatal, and infant mortality is a major challenge. As you can see, from 2019 to 2024, we can give you these few figures. For maternal mortality rate, we have 299. Neonatal mortality rate is 18. Infant mortality rate 39. Let's say that the country has developed a number of approaches and adopted a number of strategies to improve health care provision and reduce maternal, neonatal, and infant mortality. It is in this context that the MCH Handbook provides support. History of the MCH Handbook. The implementation of the recommendations from the 8th International Conference on the MCH Handbook held in Kenya in October 2012 has enabled the development of the said record in Gabon. Gabon's MCH Handbook was developed by the Ministry of Health in 2012 with technical and financial support from JICA and the French Development Agency, and the official launch in 2013 was made in Libreville at the Senate Palace. 66,000 copies have been reproduced and made available free of charge to public health facilities throughout the country. Development of the MCH Handbook. In November-December 2021, a survey was made on the use of MCH Handbook. In March 2022, update of the MCH Handbook. In October 2022, consensus workshop was held on the management of the MCH Handbook. In 2023, in January precisely, there has a development of the MCH Handbook User Guide. In 2023, from March, a training for care providers. And 2023, in April, there was an availability of the MCH Handbook in health facilities. Survey of the MCH Handbook. The targets being 22 public, private, and military health facilities, and the survey was conducted in November and December 2021. So, conducted by the Maternal and Child Health Department and divided into 5 themes in collaboration with JICA. 4 types of questionnaires were administrated. So, let's say that from the administrative staff, 22 people have been interviewed, 92 for health workers, about 330 for parents that have been interviewed, and about 330 people for the examination of the handbook. At the end of the survey, let's say that the survey was carried out in 3 main health regions of Gabon, including Libreville-Ovendo, with the west side, in the estuary, in the center that we call Moyen Ogui. Okay, now we are going to talk of the outcomes of this survey. For the administrative staff, MCH Handbook was available for sale to pregnant women at 64% of health facilities. Providers were supplied by printers at the range of 59%, and the average selling price was 2,000 francs CFA. Healthcare providers, insufficient space, 43%, MCH Handbook, too small, 37%, lack of training of the rules of the MCH Handbook, Growth Gov, 54%, need expressed to make the entire MCH Handbook in color, 75%. Okay, we are still in the outcome of the survey, and now we are talking of the percentage of the pricing of the handbook. So mothers and parents, price for them, the price is affordable, 50%, 54%, and for others it is expensive for 38% of people. Information of interest to mothers and vaccines. 41% of people believe it. In healthcare advice, 36%. Outpatient schedule, 26%. Child growth chart, 13%. Filling of MCH Handbook. Coverage, 77%. Past events, 43%. Ecography, early pregnancies, mid pregnancies 10%, late pregnancies 5%. Prenatal checkup, depending on the examination requested, like syphilis, hepatitis, HIV, etc., approximately 40%. Delivery summary, 23%, growth chart, 12%. Vaccination according to the vaccines administered. So, ladies and gentlemen, we are going to pursue with the update of the MCH Handbook. Updating process of the MCH Handbook. So, Ministry of Health, Gabon Society of Obstetricians and Gynecologists, Pediatric Society of Gabon, Neonatology Society of Gabon, Midwife Association of Gabon, and technical and financial partners including JICA, WHO, UNICEF, FDA, and many others. And it was a participatory approach of about 35 people. So, MCH Handbook, what is new? What is new is the adoption of medium format, the increased prescription space, the updating of pictures, the adaptation of growth curves, and the integration of new sections in the handbook. So we have two new elements to be added in the handbook, two of them, the danger signs for children and the postpartum care. Okay, we are still in the handbook, and what is new? Here, there is not something new, but you can see that the color of the curves have changed. And this work was done by a couple of specialists, including pediatricians and many others. That is why the color has moved from one unicolor to many colors now. And now, ladies and gentlemen, we are going to talk of the consensus workshop on the MCH Handbook Management. And what we have to keep in mind is that the main goal is to conduct a literature review on the MCH Handbook, to study national funding mechanisms to support MCH Handbook, and finally to drop a decree to establish the MCH Handbook legal framework in the Republic of Gabon, taking into account confidentiality, intellectual responsibility, and penalties for those offenders. Ladies and gentlemen, we are going to talk of the printing of the MCH Handbook by annual number of births in 2023. Just to say that in 2023, 57,500 copies have been printed with the help of partners like JICA, FDA, and HW2O. But in 2024, we are still expecting to print 90,000 with the same partners, and now the total number of printed being 57,500 and 24,600 under distribution. We still have a gap of 65,400 handbook as now. So in April 2023, there was an official presentation of the updated MCH Handbook, and it was made by managers of health facilities, healthcare providers, including midwives and nurses, pregnant and breastfeeding women, in the presence of the academic society, like Society of Obstetricians and Gynecologists, Society of Pediatric Midwives Association, Nursing Association, technical and financial partners, including JICA, WHO, UNICEF, FDA, and about 400 participants. Okay, ladies and gentlemen, let's mention that in 2023, the ministry, in collaboration with JICA, has drawn up the MCH Handbook for the training. And now we are going to focus on the training. Okay, let's say that in 2023, as I said before, 6 training sessions have been completed. In 3 sessions for Libreville region of Endo, 109 people trained. In West Health region,
Tum and Kango, 15 people trained. Central Health region, Lambaréné, 16 people trained, and 7 other health regions have provided 14 trainees. In total, we had 154 healthcare providers trained. And the training covered the whole of the country. And the healthcare providers trained, in particular in the region quoted here. Okay, now we move to the MCH Handbook advertising poster, and as you can see, we use cartoons to get the message across. And we've created many situations to summarize the MCH Handbook and have chosen the one represented by this poster to better popularize the booklet, which ranges from prenatal care to adolescence, including the postnatal period, the follow-up of infants. So we want to talk of this project from improving the continuum of care of mothers and children through effective use of the MCH Handbook in Gabon. This project that has been launched in 2024 by JICA, the main objectives being to improve health services and home-based practices for women's and children's health through effective use of the MCH Handbook by health workers, mothers, and families in pilot site first. And the main pilot site we have, it is West and Central Health Regions, talking of Estuaire and Moyen. And this project has 3 main activities, including training, follow-up, and assessment, inspection to other regions. And we have expected outcomes for the training. We expect to have the capacity to use the MCH Handbook effectively is strengthened by training health workers in the pilot site. For the follow-up and assessment, the expecting outcome is the capacity for effective use of the MCH Handbook as it has been strengthened by follow-up and assessment of continuing care services in the pilot site. And finally, extension to other regions, so to have a national deployment plan for the MCH Handbook as it is thrown up. So thank you very much for your kind attention. Thank you very much for your attention.
どうもありがとうございます。
Okay, again, that's a video from Gabon, a development of MCH Handbook in Gabon with Junko Watanabe. So now for the next video, it's from Nigeria, MCH Handbook in Nigeria by Dr. Ogachi Akalonu, Nutrition Technical Lead, National Primary Health Care Development Agency from Nigeria.
Greetings, Professor Nakamura, Mrs. Bandu, Dr. Kelvin, and all the beautiful people in this great conference. I'm Dr. Ogechi Akalonu from National Primary Healthcare Development Agency. I bring you greetings from Nigeria, and I also want to share our story of MCH Handbook. The National Primary Healthcare Development Agency is a parastatal under the Federal Ministry of Health that provides technical and programmatic support to states, LGA, and other stakeholders in functioning, planning, implementation, supervision, and monitoring of primary healthcare services in Nigeria. In living up to our goals of making Nigeria healthy, we adhere to 9 mandates without compromise. They are: provide support to national health policy for the development of primary health care, provide technical support for planning, management, and implementation of primary health care. We also mobilize resources national and internationally for the development of primary health care. We promote health manpower development needed for the functional primary health care through orientation and education, among others. The placement of home-based records is one of the very important interventions we carry out in National Primary Healthcare Development Agency. So placement of home-based record is a passport to primary healthcare systems and its services. It's an also very important activity that facilitates referral and follow-up of clients and patients. We had findings from this review that reveal that the combined mother and child health handbook promotes family, community, health workers' participation. It ensures a continuum of care, and it has pictorials with illustrations, very handy, with rich content, comprehensive, attractive, and also durable. It's also convenient for the mother to have a combined document, the mother and the child, all in one booklet, you know. So this informed the need for us to update our single home-based records to Mother and Child Health Handbook in Nigeria. So this is our story. We started in-house review, and then we later called other departments, immunization, planning research, and other departments in the agency, including UNICEF. So we sat and then we reviewed some of the home-based records we have in country, and we later took it to our then Chief Executive Officer for a buy-in, and then we were told to present our findings to the core group, and this core group are made up of UNICEF, World Bank, Wellbeing Foundation Africa, Nutrition International, Helen Keller, JICA, WHO, and professional bodies, among other partners we are working with. And later it was approved, and then we went further to tell the states, the primary healthcare boards, those are the people that will implement this handbook, and they also said, oh, it's a good document that it will enhance referral and the continuum of care. So after that, we had a national stakeholder workshop and several preparatory meetings towards a 3-day review and the harmonization, finalization of the handbook. And we had a 3-day meeting, and Mrs. Bando, seated here today, was active in that 3-day meeting. She participated, and she also brought some very technical materials that we use, including those of other countries. And then we had an inception meeting with Think Place Senegal. UNICEF procured a consultant for us during the process, and we went to the field with Think Place Senegal to pilot and field test the handbook. I also participated during the 2013 international conference via Zoom to tell our story too of this handbook. We also got approval from the ethical committee before we went to the field for the field test. And when we came back, we called the core group and the other relevant partners for input. And then we later had a print-ready copy. And we had a national validation meeting, also rollout meeting. And we had further inputs from participants in this process. And at the end of the day, we had a final copy. And then we had a new ED. He was also interested in this handbook. His name is Dr. Mui Aino. He just came on board, and we have discussed this document with him, and also UNICEF and other key partners have discussed this very important document with him. So we are waiting for a thumbs up. We are waiting for his approval, to sign it so that we can distribute and ensure that health workers and mothers have started using it. So I want to share with us the content of the Mother and Child Health Handbook. We have different sections. We have the immunization section in the health section. We have nutrition. Nutrition is talking about breastfeeding, maternal nutrition, vitamin A supplement, and other commodities, the MOAC, the growth monitoring and promotion. We have WASH session. We have early child development. We also have ANC and PNC section, health promotion, key messages, and we also have male involvement in the document. That makes the Nigeria handbook very unique and beautiful. So this is the picture of the single handbook. This the single handbook or home base records. This is the child health card, the existing child health card, and this is the ANC card, which we have upgraded to integrated combined mother and child health handbook. So what is the next step? The next step is to have another meeting with the new ED, our new boss, have another meeting with him, with all the partners involved in the development of this handbook. And then we develop a training guideline, and we train community workers and the health workers at the primary healthcare centers. And then we hope to launch it and distribute seed stock to the health facilities and also to the community where we have pregnant women and their children under 5. And then we hope to sensitize the community and also conduct advocacy to solicit more support from the government for improved political will, so that this handbook, because when we use it, it will go a long way to reduce morbidity and mortality in pregnant women and children under 5. And we're going to track the utilization to ensure that every child, no child is mixed, no eligible child is mixed, no eligible pregnant woman is mixed. All eligible clients will have this handbook. This is the images captured during the process. We started this process as far back as 2019. And these are some of the images we captured during our various meetings with different stakeholders. And also this is the finalization meeting. I am happy to tell us that Mrs. Akemi Bando was with us for 3 days, supporting us technically with a lot of materials and a lot of experience we gathered, and making it a very memorable outings during that time, 2022. And this is the meeting with Think Place Senegal during the inception and also planning meeting for the field test. And I also participated in the 13th International Conference. I was also a speaker telling our story of the MCH Handbook. And this is another image showing where we were planning for the rollout. We gathered the stakeholders to come and identify their areas of support. So some have also told us that they will be involved in the training. Some say they will be involved in the monitoring of the handbook, the usage, and also supportive supervision. So we have support from partners. Thank you very much. Good day.
Thank you very much to our online presenters. I think it's fitting to call them again to recognize them. Okay, so first we had Dr. Shafi Buyan. We also had Toru Sadamori, Dr. Oscar Tihabosi.
We also
and
have Junko Watanabe,
Aline Sylvie Dicambi Maganga.
Dr. Ogechi Akalon. So
Okay,
again, that is for our
a round of
venues.
applause for our online presenters, or except for Dr. Oscar, he's here. So at this point, we will be moving forward to our
Open
plenary
forum?
open forum. Yes. So we already have the
Collated
questions
all the
here. Yes, we have the
questions.
collated questions here. May we request uh, uh, assistance from our technical team to provide at least 2 microphones on our venue.
Okay, let me so we will be requesting Sir Patrick to
To be here on stage the following presenters. So
first we have Professor Yusihedi Nakamura, the Chairman International Committee on MCH Handbook. This
yes,
is
and
from
then
Japan.
may we also have Dr. Lourdes Herrera Cadillo, Associate Professor, Department of Nursing, Faculty of Health Sciences, Asahi University.
Ms. Keiko Osaki, Senior Advisor on Health, Japan International Cooperation Agency.
And also Dr. Oscar Tihabosi, General Direction of Care Provision, Traditional and Modern Medicine, Nutrition and Facilities Accreditation in Burundi.
So again, we will
so
be
I think
reading
we're-
all the
yes, the
online
the
questions.
questions gathered from our online participants, and I think some of them also gave questions, no, through the QR code. Apo, sige po. Sige, sir. Bibigyan natin sila ng mic. Can we have some more microphones? Thank you. So I think we're ready to begin. So let's have this first question. This is addressed to Dr. Lourdes Herrera Cadillo. First question, what experiences from your country or region do you think can be applied or shared with the Philippines in terms of the MCH Handbook?
Thank you very much for the questions. And I think from our stand, I think that we can have input about the information for special needs mothers that we have heard about today. And also, maybe we can also have care for people with special needs, not only mothers but also children, including children. And what I would like to see in the Filipino handbook is maybe a page for mothers. I saw a page for doctor notes, but I couldn't see a page for mothers or fathers to be. Thank you.
So you want to include a page specifically for mothers or fathers for them to write
To
their
write
notes.
about their experiences, maybe
okay.
their questions, also their doubts, if they have any concerns.
So
also.
it will be more interactive.
And also something for their children to read about.
Yeah. Okay, thank you for answering the question. Yes, Ms.
So,
Arlene?
Sir Pat, we have also a question for Professor Yoshihide Nakamura. Okay, the question is, the lecture mentioned that there is an app version at the handbook in Japan. Do you think making this app version of the MCH handbook in the Philippines is advantageous?
Yeah, thank you very much for very good and important questions. And I think so. Apple version might have a very big advantage in the Philippines also. Yeah, because younger generation have the affinity of Apple much more, and so but so problem is most of the decision maker are old generations. That's why we must listen the voice of the younger generation much more is important. Yeah.
Okay, thank you. Thank you, Dr. Nakamura, for answering the question. Um, let's have this next question. Actually, this is specifically addressed to Dr. Sarawut Bunsuk, but it's no longer here. But this is very interesting. It was mentioned that only 1/4 of the husbands attend classes. How do you think can the husbands be more involved in the journey of motherhood, such as in attending mother classes? So this can be answered by any one of you. I'll repeat the question. It was mentioned that only 1/4 of the husbands attend classes. How do you think can the husbands be more involved in the journey of motherhood, such as in attending mother classes?
Thank you. I cannot answer on behalf of him though. So based on the observation in Indonesia, so they said the 4 times of the antenatal care during the mother's class during the pregnancy. So one time is decided to invite husband. So the session with the husband is set in the mother's class is one clue. And in Japan case, sometimes in the mother's class, the ex-mother's class participants are invited as a senior. It means they already have the babies, and the father with a newborn come as the lecturer or the peer for the mother's class with husband. So there's some kind of experience that can answer to that point, I guess. Thank you.
Thank you.
Thank you so much, ma'am. Next question, or do you have?
Mother's class, it's called
Parents
parents class.
Yes,
And it's
yes.
open during the weekends.
Yes,
Weekends. Yeah, that's good.
Okay. Next question. So, how did you encourage your local chief leaders to invest in the Safe Motherhood program in the light of the low budget or insufficient budget for maternal health?
I think that question is
How
for
do you
Dr.
encourage-
Lourdes.
For
Cadillo.
Dr. Lourdes.
Okay, thank you for the question. And from the stand that I took today, from the presentation that I made today, we are talking about a hospital, and we are not having local chief leaders, or we don't have any budget from the community, because this is in the case I presented today, I was talking about the general hospital. It's a national hospital, so the funds we use come from the Ministry of Health. So I don't know if anybody can talk about investment or how to
Like,
encourage.
how do you encourage your local leaders or your local government to invest more or spend more on maternal health care? Anyone who would? Okay. Yeah. So I think this question, this is for all. Anyone can answer this question. No specific this is not addressed to any specific presenter. How does your country maximize community health volunteers or workers in increasing utilization of the MCH Handbook? Again, how does your country maximize community health volunteers or workers in increasing utilization of the MCH Handbook?
I can talk about the experience in the Dominican Republic, how community health volunteers were trained and motivated. And they had, of course, they didn't have a salary because they are volunteers, but they had some incentives to work with the program. And they were very involved in the program. So there was training was basic and crucial with them. They were trained regularly. They had regular meetings to give them support, and they were always eager to be involved with the community because the work they do in the community was so important to them that it was not only about their work but working with the people. They represent the community. So I think that is one very good reason they continue working.
They are really committed to
working.
volunteer and
Yes.
to
and
assist.
to continue the work on MCH.
So
handbooks.
may we ask Dr. Cadillo, who gives them training? You mentioned that they were given regular trainings and
Yes.
motivation. So who speak to them?
So we did have at the time we had a coordinator. The coordinator of the MCH handbook was in charge of providing training regularly.
Okay, that's good to know. I think Professor Nakamura would like to add some more.
Yeah, I would like to say my first experience in Indonesia in rural areas. When we first introduced MCH handbook in rural areas in Indonesia, at that time key person is a village health volunteers and in Indonesia. So they loves MCH handbook. So first, we are consider this MCH handbook is valuable or not. But first, it is very lucky for most of the village health volunteers love the MCH handbook, and so that's one of the very big potential to expand MCH handbook to other areas. But at that time, Lourdes also said training is very important. So at that time, training by doctors and the nurse is, and so they give us a proper guidance to the health volunteers. After that, health volunteers can do very good work. Yeah.
Yes, ma'am.
Yeah. Let me share you a story from Philippines. So I'm not talking about Japan though. So after 1 month of the Yolanda, I visited Leyte, the region 8. So actually they had a very good the guides for the community health volunteers. Their guide is the community health volunteers book. And the inside is how they use MCH handbook in their work. It's very the detail, but precisely in the simple way they describe. And the tool is they also developed one just page and they laminated. And on the first antenatal care, which page of the MCH handbook you need to explain to the pregnant woman. And the antenatal care 4, which page? The postnatal care, which page? Just one on this slide. And then on the back side, there is a calendar. So that the community health worker can use in the proper timing and the proper page of the MCH handbook to guide the mothers in the community. So I learned a lot of the good practice in the Leyte region 8. I think this is a good asset of Philippines.
Yeah, that's nice. That's really nice to know because here in the Philippines, if I may share, we call them barangay health workers. We call them VHWs, and they are very much involved in the implementation of different health programs in our local community. They are actually our partners in serving the people in the smallest communities especially in geographically isolated and disadvantaged areas and communities. Yeah. So,
So
thank
right
you
now-
for your observation.
So right
Dr.
now,
Rosa.
those questions are from online. So right now, we'll be requesting, or if you have questions, the participants
Yes.
inside.
Yes,
the
may we
plenary.
encourage our face-to-face participants here to raise their questions if you have. So kindly state your name,
your designation,
designation.
and your affiliation, and to whom you would address your inquiry.
Yes, so we provided a microphone at the center of our venue. So please feel free to raise your questions to any of our presenters. Yes,
Yes,
Dr.
sir.
Oscar.
Thank you.
Dr.
I'd like
Oscar, you have a additional.
to react to the question. What experience of your country do you think you can share with the Philippines regarding the manual? So what I can say in my presentation, I say that in our country, everyone used to do things their own way, his way, with each program focusing on its own area. So we I think a holistic approach to mother and child health is a better experience. So what I can share as experience to Philippines citizens is to improve coordination between different programs and the partners. Over you. Thank you.
Thank you,
So
Dr.
much,
Oscar.
Dr. Oscar. So right now we have a question. Yes, ma'am.
So my name is Dr. Helen Barsosio. I'm from Kenya, and I've been presenting to Noro. I lead a research group on maternal and newborn health in Western Kenya, and we have been using the MCH book and really struggled with digitizing this book, the MCH Handbook. So my question is to both Seiko from JICA as well as Professor who represents the International Mother-Child Handbook. Is what has been your experience with digitizing the MCH Handbook? And how do you still retain its user-friendliness, that the book still belongs to the mother and baby, even in the context of digitizing this book? And my next question is to the director from Burundi. Thank you for your presentation. And I'd like you to speak about the place of governance and leadership in making sure this book works. And I think that point needs to be emphasized the most. I saw the first step where the president made a decree and it made it possible to roll out the book in the entire country. So the place for governance, political commitment and goodwill in sustaining the MCH book throughout. Thank you.
Yeah, so the first question is about
Digital.
your experience in trying to digitalize the
MCH.
NCH handbook.
Oh, okay. Thank you very much. So for a very nice questions and so very important themes. And we also in 2016, 8 years ago, we discussed such as digitalization of the MCH handbook in the international conference here in Tokyo. And but so still, so we are continue to discuss how to do. And so because that means still so we are not reached to the results. But so in this time, so still we think we would like to do the so both. So digitalization have some advantage, okay, and we can do the good, and we can write down the new information and very good advantage. But so paper one also have very good advantage. and any time, so any people can lie down, and so such handwriting is a very warm, heartwarming, and it strengthens the bondage between the mothers and the children. And we have so both advantage. That's why we can use both. And in this time, still we must consider the concept of the no one left behind. If we use so all the Apple or digital ones, and in remote areas, and indigenous people, so such most vulnerable people, so we are not left behind. That's why so on the concept of the no one left behind, so we still keep the book one, and we will like to develop also digital one. So that's a both. It's also in this time, so our concept, okay?
So I think it will be depending on the location, the of the community. Because yeah, for example, if you're located in the far-flung areas,
Yes.
geographically isolated
Yes.
areas, the concern will be about internet connection.
Yes.
And
That's
the
right.
technology,
Yeah.
advancement of technology in that area. Yeah.
That's right. Yeah.
Thank you so much. For the next question, how about
Any more question from our? I think
any additional?
An
Also because-
addition.
Yeah. So
And
some
then
addition.
Dr. Oscar will answer.
Thank you for your question. Let me correct a bit. It is not a presidential decree, but rather a joint order which has been signed between the two ministers, one in charge of public health and one in charge of home affairs. We believe that several ministries or several sectors need to be involved too, especially the ministry in charge of home affairs, which has a broad access to community. For example, when we want to promote awareness to the communities, the ministry in charge of affairs must be involved. The experience, the survey which has been done in Burundi with the JICA support, not the very where that the ministry in charge of home affairs must be involved if you want to improve really the maternal and the child health handbook. Thank you.
Okay, thank you. I think
Any additional?
Okay, just a simple addition. Yeah, thank you for your questions. So we have also discussed with many countries how we utilize the digital powers to ensure the continuum care. Besides, together with MCH Handbook, some country has the simple discussions that if we have applications, we can waive the printing fee every year. But I'm sorry, so far we don't have this evidence. So usually we need to pay more for the internet connections or the form environments so that everyone can get the benefit. So step by step, the many countries are struggling to make a big harmonization with the digitalization and the paper one. And maybe so the like MCH Handbook, digitalization is a way or the tool. So the purpose and objectives and the conceptualization is very important at the start. So for the reviewing, for the tracking, for what you would like to use digital platforms. So at least we know that digital registry is necessary as the basis. And also the privacy policy is very important when we would like to implement it and the design for the implementation. But anyway, we need to continue to consider about it. Thank you.
Thank you so much, Ms. Keiko Osaki. So we have also another question.
another
Again,
question.
kindly state your name, your designation, your affiliation, and to whom you would address your inquiry. Thank you, ma'am. To all. for the monitoring tools. Who would like to answer?
Monitoring.
Monitoring tools. Yes.
Your question is about how to have the monitoring of the implementation of MCH Handbook. Thank you. So it's very important aspect. So because some country has using the monitoring, they're doing the service settings. When you do the spotty supervision of the normal the services, that you add implementation of MCH Handbook together, where there the health workers are using it as you expected. Another aspect, as I told you, like stock out, maybe you can consider how to monitor it. Where there, all facilities are equipped with the MCH Handbook for the next month's visit. Like that kind of the facility level monitoring also can be designed like Burundi did. And also the Indonesia presented as the national population surveys. So this is also a kind of the monitoring platform. Most of your country has DHS. DHS allow us to monitor immunization record ownership among the children, but not beyond that. If you have the access, you are the program manager of the countries, you can approach to the DHS person in your country. Please measure our MCH Handbook implementation in DHS questionnaire. Indonesia add 1 items MCH Handbook use antenatal care. So that's why that we can have data, but not many countries adopted indicators to measure implementation of MCH Handbook in DHS.
Okay.
Thank you for your question. Any more questions from our live audience here? You can approach Sir Paul. Okay, we have.
Good afternoon, ma'am.
Vice Andres from the Central Office of the Department of Health. Do you have any experience or have you heard any best practice from other countries on making the MCH handbook PWD friendly or persons with disability friendly handbook? Thank you.
She's
Person with disability.
yeah.
Disability, yes. Would like to answer?
Yeah, thank you very much. And I have two experience. I would like to say experience in Japan about disability, person with disability and maternal and child health handbook. Okay, one is for person with visually disability person. So we have braille, braille version, but so it is very heavy. And so, but so another one is if we use all the and another version is we use all the contents of the MCH handbook. So in digital one, so people can get a voice.
Yeah, they can hear.
Yeah. And so they can listen to contents of the MCH handbook. That's much more easy for them. Okay. And another is I already mentioned. So some mothers with intellectual disability already have children, pregnant and children. So for them, it is very difficult to understand the usual MCH handbook written in Japanese But it is very difficult for them to understand. That's why so we make a so special version of the easy understanding writing for the intellectual so people with intellectual so disabilities. And so this is we need a so special support for the so specialist. And we change the so content is the same, but so how to express the content is so we must
There will be
change.
like different approach.
Different approach.
Yeah,
That's
according
all.
to the condition of the mothers.
Yes, and so that's why so we make a so such MCH handbook is modified with the people with disability and so people with special needs. Okay.
Thank you, Professor Nakamura.
Do you have any additional? Yes, ma'am? Yeah. Okay, none. So, do we still have online or face-to-face
Questions.
questions?
Questions
If
from our
none-
live audience? Some more?
Okay, none. So, we
I
will
think
now
we're-
proceed to the next.
Yeah. To the next part of our program.
Again, we are so thankful for the answers.
Yeah,
There's so
again,
many
may we
online
invite
questions.
everyone to give a round of applause for our presenters, Professor Nakamura, Dr. Oscar, Dr. Lourdes, and Dr. Seiko. Keiko. Thank you.
So right now, sir, we will be awarding
Yes, we will be proceed. We will proceed with the,
the awarding
awarding
of
of certificates.
So we can invite some of our
Yes, may
bosses.
we invite for the awarding of the certificate of appreciation. May we invite on stage our Assistant Regional Director of the Center for Health Development Calabarzon, Dr. Leda M. Hernandez. Also, Dr. Maria Elena G. Castillo Gonzalez, the Local Health Support Division Chief of the CHD Calabarzon, and of course,
Dr. Monica
Dr.
Jennifer Victorino, Chief Regulation, Licensing, and Enforcement Division.
And also Miss Dr. Si Doc Nick. Can we also invite Doc Nick Santos?
Nicolas Santos, our Family Health Cluster Head, and also Regional Safe Motherhood Program Manager, Ma'am Vanessa, and Maternal Health Medical Coordinator, Dr. Hatsumi Noda. And also may we request Professor Yoshihide Nakamura and also Professor Calvin de los Reyes, board member of International Committee on MSH
Okay, so may
Handbook.
we have on stage also Professor Calvin de los Reyes, board member of the Philippines International Committee on MCH Handbook, and of course, Professor Yasuhide Nakamura, the chairman of the International MCH Handbook.
So let me read the citation of the Certificate of Appreciation is awarded to Dr. Lourdes Herrera Cadillo for sharing her invaluable time and expertise as a resource speaker for a discussion entitled MCH Handbook for High-Risk Mothers in South America during the Safe Beginnings First Regional Conference on Maternal and Child Health in Calabarzon, in partnership with the 14th International Conference on the MCH Handbook, given this 9th day of May 2024 at the Lime Resort in Pasay City, Metro Manila, Philippines, signed by our Assistant Secretary of Health, Ariel I. Valencia. Dr. Lourdes Herrera Cadillo.
Another certificate of appreciation is awarded to Ms. Keiko Osaki for sharing her invaluable time and expertise as a resource speaker for the discussion entitled Strengthening Implementation of Maternal and Child Health Handbooks Across the Globe during the Safe Beginnings First Regional Conference on Maternal and Child Health in Calabarzon. This is in partnership with the 14th International Conference on the MCH Handbook, given this 9th day of May 2024 at the Lime Resort in Pasay City, Metro Manila, Philippines. Signed, Dr. Ariel I. Valencia, Assistant Secretary of Health.
The next certificate of appreciation is awarded to Dr. Oscar Tihabose for sharing his invaluable time and expertise as a resource speaker for the discussion entitled The Use of Maternal and Child Health Handbook in Burundi. What is the way forward? During the Safe Beginnings First Regional Conference on Maternal and Child Health, MCH in Calabarzon, in partnership with the 14th International Conference and MCH Handbook, given this 9th day of May 2024 at the Lime Resort in Pasay City, Metro Manila, Philippines. Signed, Assistant Secretary of Health, Ariel I. Valencia. Again, thank you, Dr. Oscar T. Habobsi.
Thank you na lang sa mga sponsors. Tsaka yan ang gusto mo yung sa food, sa dinner.
Kanina. So again, thank you so much to our sharers, professors and doctors who help us today.
Okay, but I think before we end our program, we would like to make some announcement. So dinner will be served here in our venue. Okay, it will be available from 5:30 p.m. up to 8 p.m. Okay, 9 p.m. will be the latest time. Okay, that our dinner will be served. So again, our dinner will be served here tonight, starting at 5:30 p.m. up to 9 p.m. 9 p.m. is the latest time.
Okay, and the breakfast would be at 6:30 a.m. to 9 a.m. at Bayside ground floor.
Yeah.
So again, the program will start tomorrow at exactly 9 a.m.
Yes. So again, breakfast at the Bayside ground floor, starting at 6:30 a.m. up to 9 a.m. And then our program for the second and last day of this conference will start tomorrow at 9 a.m. Okay. Again,
thank you for joining us at the first regional conference on maternal and child health, MCH in Calabarzon, in partnership with the 14th International Conference on the MCH Handbook. This has been your host, Arlene Borbe Molines from Health Education and Promotion Unit.
And I am Patrick Aurepepa from the Human Resource Development Section. Again, this event is organized by the Department of Health Center for Health Development Calabarzon in collaboration with the International Committee of the MCH Handbook and the University of the Philippines, Manila. Maraming salamat po. Thank you.
Thank you and good night.
See you here.
A lot of learning. Thank you so much.